Uh, Thank you. So I'm Nupur Tyagi, working with Fair India, and I have the privilege of moderating this very critical discussion today. So at the outset, I would like to first thank each and every one of you, our esteemed speakers, panelists, and participants for taking the time to be here. We are especially grateful to the government representatives from government agencies, disaster management authorities, civil societies, and academia who have joined us today from different parts of the country. So just to briefly set the context for the discussion and the consultation today, as all of you know that this consultation, it comes at a very crucial moment. Even though we are only now in early April, we are already witnessing reports of severe heat waves and extreme temperatures across several parts of the country. This early onset is alarming, and it also reminds us just how urgent and pressing the challenge of heat wave preparedness is. So, as many of you will also recall that the summer of 2024, it also marked the most extreme and prolonged heat waves in India. Uh, we saw temperatures above 49 degrees with multiple fatalities reported across different parts of the country. And we saw disruptions, widespread disruptions across public health, water supply, agriculture, and electricity, amongst others. So we are seeing that heat wave, it is not anymore just a seasonal spike in temperature, but it's now become a climate emergency. And it is no longer the occasional weather anomalies, but rather it is becoming one of the most lethal climate risks facing India. So we are at that point where strengthening preparedness and resilience, it's not just a choice anymore, but it is definitely an absolute necessity. Today we are honored to be joined by an illustrious and diverse panel of thought leaders, practitioners who bring a deep expertise and experiences from different corners of the country and also different sectors. So with today's session, we hope that we'll get to unpack the lessons we've learned from previous heat waves that various stakeholders and experts have experienced. What are the emerging gaps in the systems, and more importantly, what can be the way forward for this network, for this sector. So before we begin, I'll just briefly outline the session format. So first, we'll start with sharing from our esteemed speakers who will be sharing their insights and perspectives and also their experiences with heat waves. And this will be followed by a question and answer session where participants can engage with our speakers directly. And throughout the session, we still encourage you to drop your questions in the chat and we can address them in the question and answer section, or the speakers can also respond to them during the session. So without further delay, we will now begin today's session. And I'm very pleased to invite Lieutenant General Yogendra Dimriji, who brings nearly 4 decades of distinguished service in the Indian Army and has an extensive experience in disaster management across challenging terrains. Currently serving as the Vice Chairperson of UP State Disaster Management Authority, he's leading the state's proactive community-based and technology-driven disaster resilience strategy. So, General Dimri will be sharing his inaugural address with us, where he'll be focusing on strengthening institutional leadership and how we can strengthen multi-stakeholder collaboration for heat wave resilience in India. So we welcome you and we hand it to you for your insights and remarks.
Well, thank you very much. And am I audible?
Yes.
Okay. So good afternoon, everybody. It's a very good feeling to be back amongst you all, this time for the national consultation on strengthening heat wave preparedness and mitigation. Very onerous initiative, I must say, taken by Sphere India. And that brings so many of us from very diverse organizations together for a common cause. So to start with, congratulations on this initiative. Now, during the next 2.5 hours or so, I am sure that many of you will speak on the climate breakdown, the annual global temperatures breaching targets, what last year was like, and what are the temperatures above the pre-industrial levels, all that. So my approach is going to be, over the next 10 or 12 minutes, a little more parochial to the state where I'm currently serving, and more importantly, based on actions to beat the IMD extreme heat predictions for this summer. So trying to make it a little specific, but then it'll surely have enough for all of you to decipher for yourselves what you can pick up from that, right? So yes, like everywhere else in Uttar Pradesh, 2024 was unprecedented. And we found that, well, here's a state which normally had 2 or 4 districts which we touch 46 degrees every summer, but this year we had 16 of them, and that's quite a number. A city just shy of 50, 4 above 48, 5 above 47, 6 above 40. So that's the kind. And the best part was that every city over here, every district was about a degree to 4 degrees above its normal. So, and you all know what every 1 degree can mean. This was one part. The other part was, well, 23, we had just about 90 heat wave days, and last year we had about a phenomenal 436. So both sides, temperatures soaring and number of heat days increasing, huge rise in both frequency and intensity. That it was. And Uttar Pradesh is a little challenging state, our diverse geography, the kind of agroclimatic zones we have, the substantial population we have. And within that population, the amount of workforce, it amounts to nearly a workforce of over 11 crores, primarily agrarian, 55% of them, and another about 15% of the industrial sector. So that's a huge, huge lot. The balance 30% is in the services. And now that makes our people increasingly vulnerable. Uh, and the impacts, of course, on the social side, economic side, and the health that follow. But then it's not just the farmers and the workers or the less privileged, but then you have the elderly, the children, the ones with pre-existing health conditions. They remain the most vulnerable. And in a state like ours, the health risks in the rapidly emerging, densely populated urban centers that are springing up, that's also very significant. And therefore, it's very important and very urgent in our state that we take heat waves very, very seriously. So what do we do? To start with, we have our heat resilience plans, and they are much in place. Heat wave in UP stands notified as a state disaster, like and, like another 3, 4 states have done. And beyond this, what we do is we make sure that our heat action plans put through our entire chain through a process of risk assessment, preparedness reviews, dissemination of forecasts and alerts, and a response finally by all concerned, everybody that you can think of. And I'll elaborate on this a little from now. For the last 4 years, we've been making the state heat action plan, incorporating our lessons learned every passing year, and making sure we commit all our districts, all our departments, all our agencies to undertake mitigation measures during the year. And let me assure you, it's followed up very meticulously in our districts and the DDMAs, who prepare their heat action plans as well before the onset of summer. I mean, we've done this in about Feb this year. And perhaps we're the only state where each of our 75 districts have developed, they review, they implement their own heat action plans. And that's in keeping with climate change or the urban disaster management authorities, which are now springing up. Along with that, the city heat action plans have also commenced. So I think the state has gone pretty far on this. Now, with this kind of a backdrop, what's working for us? And that's something I'd like you all to take note. Firstly, is overcoming this implementation challenge. You all know plans are very, very fine. Biggest challenge is how you're making sure that you're implementing them the way you want. So towards this, let me tell you that the SDMA has developed a mechanism for a very regular monitoring and evaluation. And this is accompanied by a hand-holding and a supportive supervision of our district heat action plans and our city heat action plans. We have a framework with us for a very timely reporting, and some of you may be on our groups who would be taking note of that. Some of you all do pitch in as well. So we make a very detailed record of our field level activities. We document the initiatives for prevention, management of heat related illnesses, right? And all this is in line with the NDMA's ATR, let me tell you that. And with this, every year, what we do is we rank our districts, all 75 of them, on several criteria, such as the review of the previous district heat action plan. What is the training they've conducted? What IC activities they've conducted? Best practices, their media sensitization, all that. And then we recognize the best 5 every year around the month of Feb when we get together, right? So that's how we try and overcome this challenge. Then it is also our business to ensure that heat wave advisories and the precautions and actions that are required to be taken, they reach the community at the earliest. And then the alerts that are generated by the early warning agencies for heat waves, severe heat waves, etc., they reach the entire community at the fastest. And there are two things here you all must take note of, two developments that have taken place in the state in this regard. First is the intervention of contemporary technology, which today lends itself to precision, lends itself to timelines, and it is a very important place in our climate strategy. So I must inform you that last year, the state has leveraged technology and analytical tools in a very, very huge way. And that's for early warning, forecasting, monitoring, and accurate granular assessment. And that's happened because of the installation of 2,450, I repeat, 2,450 AWS and ARG in every tehsil and every block. And you compare this with the paltry 130 odd that we had the previous year. So therefore, today, every tehsil, every block in the district is monitoring its temperature, its humidity, the rainfall, whatever have you. Now, this is one part. The second part is that we've determined heat thresholds at the district level. Now, this is a cornerstone to shape effective policies to safeguard public health or optimize on agriculture or undertake resilient urban planning. So today, every district and every city knows the threshold, the heat threshold for the yellow, orange, and red alerts from the state AWS ARG dashboard, which is available to them, and they take anticipatory actions accordingly. Whether you ask anyone today, he'll tell you, well, for yellow alert, for red alert, we need to do this. But here, specifically at what temperature, what time, when should they start, and what action should be taken is well known to them. Once they take both these together, the temperature and the threshold, I think there is a very well-informed preparedness and a very dynamic response that we see forthcoming this year. The next aspect, I think, which works is the coordination, collaboration, cooperation. Now, coordination of this collaborative effort and the cooperation is the mainstay of our effective implementation. And I must tell you, our quality, our bureaucracy, the disaster management, our NGOs and CSOs, everybody's involved. And the Chief Minister himself leads a very high-level meeting chaired by him only to combat heat waves. And then the SDMA whole of last month has been involved in organizing workshops in turn to engage over the 20 major state departments, spent 2 days with each of the 75 districts and the 5 Nagar Nigams, and another day with about over 25 NGOs. That's where the action lies, like the forum that we have here today. Apart from the NDMA, then you have the revenue department. They review the actions by all districts, as do the departments in their own chains. So I think there's a very big collaboration and coordination that's working here. So I'm sure if somebody have questions later on, I'll be able to inform them how things worked out for us last year as well and what made it go. I'll leave it for that. Then I must tell you about our focus on urban areas, because I told you, well, the state is emerging big and strong and economically and otherwise. And for these reasons of urbanization, industrialization, or the construction in the hazard zones, our climate change risk management has focused us on to our urban centers now. And of the 20 major towns that we have in this state, today city heat action plans for Lucknow, Agra, Jhansi, they are in place and they're being worked on, they're being implemented. And work on Prayagraj and Kanpur is in progress. They should be over in another month and a half. And we told ourselves that the balance 15 we're going to finish over the course of this year. So that's how we are addressing the UDMAs, which are coming up, and our urban centers, right? But then city heat action plans are just one part of a much larger climate action plans and plans to conserve forests, waste management, etc., that we have for our cities in place, right? So lastly, before I end, just 2 or 3 recommendations that I must make is that, well, yes, you will find that in each and every state, the state heat action or the district heat action plan activities are limited to very short-term responses. Come the season, it's water point, shade, preventive actions, awareness training, etc. I think what we need is a much more long-term mitigation and adaptation efforts, which is lacking all across. And that's something which we are trying to put our efforts on from this year onwards. I mean, I'm talking of things like promoting blue-green infra, cool roof technologies, going and identifying the most vulnerable, helping them out the most, focus on behavioral change, focus on communications. That's something we're planning to do this year. Next is about funding gaps and sensitizing policymakers. Look, where do the funds lie? I mean, heat has come to such a state that you need dedicated funds to implement the heat action plans at all levels, city, district, and the state. And this funding provision is very essential. And it's not just about your state mitigation funds. There are so many centrally sponsored schemes which cater to these funds as well. I think this sensitization is very essential. And lastly, what I mentioned in every forum, to make sure that it's not just about plans, it's about using traditional practices. Look for shades, look for trees, look for Gom Katira, as much water, as much juices you can give to the people, nothing like that. And we strongly, lastly, believe that all heat related illnesses, all heat related deaths are entirely preventable. That's our conviction. If there is a mortality, to us it means we failed to provide that individual with a little bit of shade and water. Just these two things. I think that's what we need to depend into. So before I end, let me once again thank Spare India for this initiative, which I'm very, very sanguine will go a very long way to strengthen the preparedness and mitigation, combat the heat waves in the ensuing season. I notice you have a very, very well structured and a well represented schedule ahead. Wish you all very healthy and fruitful discussions. Thank you. Jai Hind.
Thank you so much, sir. Thank you for sharing your experiences and insights from this day. And we really appreciate the very valuable perspectives you have shared. And we hope to take the learning from your experience to other parts of the country as well. So thank you for that, sir. So next, we'll move to our next speaker. We have Dr. Surya Prakash joining us. He's head of geohydrometeorological risks at National Institute of Disaster Management, and he's leading the multi-hazard management, national coordination, and international collaboration in disaster risk reduction. So Professor Surya Prakash will be reflecting on the impact of heat waves and also elaborating a bit on historical trends and severity of heat waves in India. So with that, I will hand it over to you, Dr.
Thank you, Nupurji. Am I audible?
Yes, sir, you are.
Okay. Good afternoon to all. After hearing VC UPSDMA and his views, I think there is less to talk and more for action that he spoke about, and the initiatives that UPSDMA has undertaken. I think they deserve our all appreciations, and the interventions that are likely to help all of us during this period of heat waves, which are going to start from April, May, and it's likely to continue till end of the June. So we are just at the entrance of the heat wave period. And is there anything else? So I think there is no need to talk about how we declare the heat waves, because our India Meteorological Organization department has already taken up these initiatives and decided the parameters for declaration of heat waves in the hills and the plains. And these parameters have been globally adopted as well. So the deviations above the normal temperature, which is normal usually 4.5 degree centigrade to 6.4 degree, is considered to be in the range of heat waves. And if it is more than that, then we normally call it as severe heat waves. I belong to Rajasthan. So Rajasthan is one of the states which has very high temperature conditions. So usually during the summer periods, we have temperatures ranging from 45 to 50 degrees centigrade. And such regions are actually based on the maximum temperature conditions are already in the heat wave conditions areas. So we have to prepare against them all the times, not for the specific period of heat waves when departure is more than the normal ones. So these require actually our lifestyles to be changed. This is nothing new, though now we are talking more because of the climate change impacts, and which are acting inadvertently distributed abnormally across the different land areas. I remember when 2021 we had a uh, rockfall with the avalanche breaching in February 2021 in Chamoli district, which is an abnormal behavior of the natural physical terrains and processes besides the humans too. VCUPJ talked about the social behavioral change, which is very much required, because in the current generations, particularly when our children, they are adapted to the closed environment with ACs and other facilities and infrastructure and 24/7 power supplies. Become used to it, and they are hardly exposed to these extreme temperature conditions. So therefore, their immunity is not that good compared to the people who actually face these kind of high temperature conditions. Because for me, like we face temperatures more than 50 degrees centigrade in desertic conditions with the list of water availabilities. And then we could travel and walk in even high temperature, taking all necessary precautionary measures. But today's case, urbanization is going on. We have already more than 40% of our population in urban areas. And these urban areas are actually more sufferer than the rural areas where we used to live. Now, these urban areas have developed heat islands where a lot of concrete covers, they have actually reduced the normal capacity of the terrain to change the temperature condition. We used to have a lot of green spaces around us. And now we need to change that. And this built environment has actually increased the impact of these changed temperature conditions too. Then the lifestyles. So these two things are very, very important. Further to this, I would say that when we are working, particularly in the urban environment, but specifically I would talk about the industrial sector. The industries, the temperature is already very hot. Most of these industries, they are using heat, energy, and power. So they are themselves very source of high temperature conditions within their own environments. And further, the natural temperature conditions in the atmosphere, it adds to that temperature. So the laborers particularly, they are likely to get more exposed. If you look at the parameter, you said I have to talk about the trend and the history. Then these people, particularly the laborer class, they have been affected much more than any other class in our society, because they don't get leaves and they have to work during the peak work heat hours, particularly from 12 to 3 p.m. when the maximum temperatures are there. So naturally, our Ministry of Labor and Employment has to take care that all the industries and corporate sectors should not actually keep people engaged or move during the peak heat hours, that is from 12 to 3, and they can change them to different shifts, early morning to no or late evening hours, so that the work doesn't suffer, but on the other hand, the people's lives are also not stake. Then the other things that we often see, that people are wearing artificial clothings in terms of polystyrene and other kind of materials, which are not good for such weather conditions. Cotton is always welcome, and they should always have some kind of shady materials like hats or caps or some turbans, which you usually wear, and they actually protect direct impact of the heat on our head and also on other body parts. So most of the people, they get dehydrated during the heat times when they move a lot or work hard through sweating or through swellings or through other kind of problems in terms of you can say cramps and sometimes seizures or sometimes vomiting. That kind of problems do happen. And in that period, we are told as our traditions, to take some kind of water which mixed with some lime or some mango, unripe mango curry juice, or sometimes we take buttermilk, which are good to maintain our body temperatures as well as the moisture content or the hydrated atmosphere body. So there are a lot of issues. So besides these humans, even the livestock, they have suffered quite a lot. And the agriculture sector particularly, due to the scarcity of availability of water, many of the crop, their yields are suffering, and the fodder also becomes reduced. So therefore, we have to manage from all perspectives, be it the human health, livestock, agriculture, laboral, corporate, or industrial and other service sectors where we are changing our timings. And also, I would like to where we see UPSD may talked about the vulnerable groups, particularly the children and women, old and sick. They become quite susceptible to the impacts of such heat waves. So normally Ministry of Education closes the schools, particularly for the no, young children, so that they do not get affected. Similarly, for others also, there should be change in duty hours and also the school timings or the college timings, even if they are necessary to be opened up. So there has to be some ways where we can actually contain, control, and manage the impacts of such heat waves, either by our lifestyles or by some regulations and enforcement of some kind of risk reduction and resilience measures. Heat resilience is no doubt our motto as per national policy on disaster management, but we will be able to achieve it if all the citizens, they become aware, informed, and prepared against this risk. Usually we are not worried about day-to-day temperature changes, but when it actually affects the health conditions, it becomes very and important for their survival too. So there are a lot of issues which are likely to come up, and a lot of programs actually Government of India has initiated. I'd like to talk about them also, because it's not that we have just now become aware about it. Since long, 2015, I remember, was one of the years when maximum casualties had happened. And Government of India actually initiated national action plans on climate change, looking into the extreme temperature conditions which are to be imposed soon after this kind of changes which are taking place at the global as well as at the local levels. So this NAPCC has been one of the important missions which Government of India had started. And also there is more energy requirement. While the water availability gets reduced, power generation gets reduced, on the other hand, the demand increases. So there is no ratio proportion is not well set. So for that reason, actually can utilize this heat energy for production of power. We have a national solar power mission which can be utilized, and we can gain from the heat energy being received by our planet and distribute it for cooling purposes in our buildings and in our built environments where people work or live. Then we have also started working on state and city level heat action plans. And this was well demonstrated when the first plan, it was prepared way back in 2013 in Ahmedabad, and they could reduce the casualties to a great number. So heat action plans actually drive our attention well towards the likely hotspot areas and what we can do to address these such kind of issues. And further, this recent initiative which our NDMA has started in the form of a common alert protocol, Sachet app, which also keeps on sending and sharing this information about the changing heat conditions. So that will also advise people to keep indoors rather than going out during the peak hour conditions, heat conditions. So as said by UPSDMA, we see that we have different levels of alerts, which include yellow, orange, and red, where we say yellow means aware, and orange means prepare, and red means now act. So action is very much desirable in such conditions. And ultimately, as it is said by former no Secretary General of UN, Kofi Annan, that an aware, informed, and prepared community is better able to assess, resist, response, and recover from the disaster risk than an unaware, uninformed, and unprepared community. And we always say in disaster management, no one is well prepared until unless everyone is prepared. So let's share and exchange and enhance this awareness and information sharing and preparedness at all levels with every citizen involved into this process. And I hope we'll be able to achieve our goal of national policy on zero casualty, disaster-free and resilient nation. And I congratulate you for taking up this initiative and for sharing this information at a timely manner, because this is the right time, I think, to start sharing and keep making people more aware, informed, and prepared. So with these words, I thank you very much for providing me this opportunity, and thanks to all, and wish you safe, healthy, good quality life on an equitable, justifiable, and right-based manner with good fraternity amongst all of us. Thank you very much and wish you all the best.
Thank you. Thank you so much, Dr. Surya Prakash. We really appreciate your reflection, especially the emphasis on the disproportionate impact of heat wave on different vulnerable groups. So that is something that should definitely be considered in the planning going forward. So thank you for that sharing, Dr. Surya Prakash. We'll now move to the next set of speakers. So going forward, we have sharing from 3 states to reflect on the lessons from the past heat wave, including the key challenges, and also the speakers will reflect on adaptation plans and long-term strategies. So our first speaker, we have Shri Deepak Kumarji, who's Senior Research Officer at Bihar State Disaster Management Authority, and he specializes in heatwave management, school safety, and community-based disaster risk reduction. So I'll hand it to you, Deepak ji, to share your perspectives from Bihar.
Thank you, Nupur. Good afternoon. Welcome to all the participants and distinguished panelists of this online national consultation meeting. So on behalf of Bihar State Disaster Management Authority, I would like to thank Sphere India for organizing such a critical meeting on this critical issue of heat wave management. So I have a small presentation from Bihar, what we are doing in terms of managing the heat wave. So can I share it, Nupur?
Yes, please, Deepak, you can share your screen.
Thank you.
Yes, it's visible.
Is it visible?
Yes, yes.
Okay, thank you. So this is the data of most vulnerable districts of Bihar. Last year, total 9 districts and 25 blocks were severely affected by the heat wave, where more than 15 days were the severe condition of heat wave, and it was around 45 plus degree of temperatures in these blocks. And total 34 casualty were reported, and this is the map of Bihar heat map, and where we can see the entire South Bihar, almost South Bihar is affected by this heat wave, and this is the trend, and we can locate the districts and blocks where we are working and focusing on the management of the heat wave. So these are the blocks and districts, and last year total 34 casualties were reported by the department, but this case might be higher, but this data is from the government record. So this year we have directed and suggested all the concerned departments to record the actual data, so that in future we can plan in better way for the management and for the response and for the saving of the lives of in the Bihar itself. And these are the key challenges when we face during the planning and the response for the heat wave management process in the process. So sorry, sorry, 1 minute. So The vulnerability analysis is the area which we have to be strengthened, as our earlier speaker, Honorable Vice Chairman of UPSDMA, were telling that threshold level should be decided so that we can respond in a better way, or we can plan in a better way to save more lives. So vulnerability analysis and a plan accordingly is the area where we have in Bihar we have to work very rigorously in a very focused way. And the another thing is the heat wave illness monitoring system. This monitoring system is still lacking in Bihar, so that we can respond in real time manner, and at state level, at the block level, or at the PSC level, so that the golden hours, what we told, that golden hours we can save more lives in better way. And the last one is hospital preparedness and response to the heat wave illness. And in Bihar, we are facing the health system is improving, but the focus on the heat wave is still lacking. Like there is no as such dedicated ward for the patient of heat, those suffer by heat wave. But still, this year we have directed them to please make provisions for those patients who were suffering and in these areas, and for the priority basis, so that we can save better life, more lives on this. And this is the Bihar Heat Action Plan strategy. But this year we have implementing the Bihar Heat Action Plan, which we have prepared with support of IIPH Gandhinagar, and we have done orientation of all the districts and departments in line of the Heat Action Plan, so that they can prepare this year in better way, and they can implement all the guidelines and all the directives at the district level, at the department level, and at the city levels. And we have done 2 meetings from February to March for the preparedness at the district and department levels. And this month we are going to organize 3 meetings in consecutive 3 weeks, so that we can prepare better to respond for the heat wave casualties. And all the concerned department have already issued the directives to the districts level and blocks level to respond to the for the better response. And we during the meeting we have highlighted to focus on the Divyangjan, the elderly, and the most vulnerable groups. And we have also highlighted them to please maintain the drinking facilities in the severely affected districts and block and places where there are issues of there are crisis of water. Like in Gaya and Nevada, they are the major districts where water crisis almost every year they suffer. And we also issued directives and advisories through newspapers, television, short videos, and mass messaging, hoardings in public places, community radio. We use this mode for awareness, and we also do nukkad nataks at community level, and we also use social media platforms for the awareness purpose, and issue the directives and advisories through these channels also. And in Bihar, we have a separate system for weather alert, like Bihar Mausam Seva Kendra. They have a dedicated sensor at all the 534 blocks, so that we get the accurate data from the fields, and accordingly the Bihar Mausam Seva Kendra releases advisories and do's and don'ts, and the alert system to all the concerns from state level to panchayat levels. And we also get the information from the IMD. As earlier speakers were speaking, we also use the Sachet app for the alert system. And this year we have also planned for some activities in short term and long term. So this year we have started working on the monitoring to develop the monitoring system for the management of heat wave illness in hospitals, and also to develop the alert systems where we will have the facility of colors blinking and sound blinking, so that the concerned person, the responders and the decision makers and functionaries get alert to respond and to facilitate them if there are any requirements. And we have also, this year, we have also planned to develop a threshold level at the PSC levels on various parameters, and also at that local levels like block and districts. And we have also started on the threshold level to develop next 5 to 10 years forecasting, so that we can plan for next 5 to 10 years to plan better for the heat wave managements. And we have also started working with the health department to develop a template for the preparedness of hospitals. And there should be a dedicated wards in hospitals at PHC level and district level hospitals to for the response of heat illness patients. And at the state level, there is a building bylaws. So this year we have started working on this with a working group, so that we can also revise these bylaws in line of GRIHAP and the green rating initiatives for the housing assessment, so that we can make a better and sustainable Bihar. And this year we have also started the capacity building programs with ULBs and PRIs for all the PRIs members and functionaries who are posted at the district and state level, so that they are the person who respond and those who participates in the building structures and for the management of heat wave. And with the health department, support of health department, we are doing capacity building for health workers, doctors and functionaries at the health centers. And with support of PHED, we have started a water mobile van that we called here as a water ATM. And on that van, we have also mounted a sound system for the awareness purpose. This van is passing on this way. If there is any need of water, they can take from that van. And in Bihar, we have started Jal Jeevan Haryali Mission, and their impact is very progressive. Till last year report, total 17% green field has been created till now through this scheme, and many water resources has been rejuvenated through these schemes, and there is very positive impact of this scheme through this scheme in the field. And we have also nominated nodal officer for as a heat officer, nodal heat officer at the department level, so that we can respond very quickly through them, and we can plan better with these resource persons and at various levels. And through capacity building, we can say, through for responding for any crisis in this context as well. And this year we have a special focus on the timing of schools and for the closure of schools during the peak times of heat waves. And at the Anganwadi centers also, we have guided them to please be aware about the alert of the IMD and BMSK, so that the casualty can be minimized for the vulnerable group. And these are the some snapshots of the initiative. This is the mobile water van, and these are the do's and don'ts which we circulate with the bulletins with weather alerts. And these are the advisories, snapshot of the advisories which we release through the newspapers and hoardings. Thank you. Thank you. If there will be any questions, I will be happy to respond.
Thank you so much, Deepak, for your sharing the insights and experiences from Bihar. So next up, I would like to invite Dr. Praveen Kumar Garg, who's the state epidemiologist in Jharkhand, and he's also leading the public health preparedness and climate health programs in the state. So over to you, Dr. Praveen, for the sharing of your insights.
Yes, thank you very much for giving me this opportunity and all the dignitaries and all the panelists. I welcome you and very good afternoon to everyone. So, as per our previous speakers have emphasized on the heat mitigation plan for Bihar, and I belong to Jharkhand. Jharkhand is well covered from Bihar, having their own issues and challenges for mitigation of this heat-related illness. And can I uh, can I convey to present by one small slides? Already I have sent my PPT that can be presented in this forum.
Sir,
And yeah, I had shared, I think, yeah, please.
Kurshan, if you can maybe share the slide. Is
Yeah,
it visible,
thank you.
Dr. Praveen?
Yes. So, so in this national consultation organized by Share India, repeatedly I appreciate these consultations. And now moving forwards, in the context of Jharkhand, the previous year, what we have done that I will be highlighting. And apart from that, as India has a tropical climate, we know that, and there is a variation in the climates which leads to extreme heat, extreme cold, and so many things. And generally, we get the scorching hot climate from March to 31st of July, basically. So, from Department of Health, already Ministry of Health has implemented National Forum on Climate Change and Human Health across the pan India, in which there is a national heat-related action plan. Based on that, uh, we have we have been doing the activities as per the national action plan. And Jharkhand state has made a state action plan on climate change and human health, in which state environmental health cells has been well established in state NHM office and under the chairmanship of state health minister. This health environmental health cell has been constituted. Apart from that, we are having the state level multi-sectoral task force. That is very very important because headed by the additional chief secretary health. And in all 24 districts last year only because of extreme heat condition in the month of April, when still I remember on 26th April, chief secretary hold one meeting and in which all stakeholder departments from Panchayati Raj to education, urban development, health, all were present, in which under under chairmanship of all deputy commissioners in all 24 districts. This district level district task force, multi-sectoral task force committee has been constituted for mitigation of this kind of any disaster, either heat, either extreme cold climate, either extreme rainfall, or either extreme heat, as well as any disaster. So last year, these are the some best practices in which capacity building of the healthcare workers and awareness generation is the key fundamental behind the mitigation of behind mitigation of heat as per our state action plan. So last year, ma'am, we have conducted this 14,000 frontline healthcare workers capacity building, and also we have done this provision of drinking cold water in earthen pot free distributed in hot districts because we have done vulnerability assessments with the help of so many local NGOs as well as some self-volunteer NGOs are come up and they did it very well. And accordingly, hot spots districts have been identified, in which at district level, in district task force committee, whatever the action to be taken by DC, that was done very successfully last year. And this year, we are trying to ensure it. And if we see the last year, because main thing is that prevention of that we know the impact of heat wave on the human health in the form of heat cramps to heat rash to heat cramps to heat exhaustion to heat stroke. Okay. So in the OPD or in the health facility, preparedness is the very, very important. So Jharkhand state is willing to strengthen our health facility in terms of establishment of dedicated heat stroke room with all logistics for management of heat-related illness to the severe heat-related illness cases. So that's why in the last year, in the OPD, total 2,13,321 patients have been attended the emergency OPD. Out of that, 4,656 suspected heat stroke cases were reported, and 12 suspected heat stroke deaths were also reported from 1st March to 31st of July. So we know that as per health professional, we know that there is no any gold standard test for to diagnose the death due to heat stroke. That's why data collection and Ministry of Health has defined a very good death autopsy reporting format so that before dying, the vulnerable populations, they were in the which conditions, their physical examinations, their history, their outdoor activity, indoor activity, that to be that to be investigated through dedicated team that is called death ascertained committee that can be formed at district level with the help of clinicians, public health experts, and petition. So this kind of activity were done last year. So yeah, next please. Yes, ma'am. These are the 24 districts in which we can see there are 4 deaths were reported from Palamu, 6 from East Singhbum. East Singhbum, Jamshedpur is the headquarter, very extreme hot weather, and and we know the definition that if there is a consecutive 5 to 6 days having deviation from the more than 5 to 6 degrees temperature from the normal, that is called severe heat stroke. And Jamshedpur already falls in this category. So 6 deaths were reported and 2 in Chatra. So this is the overall district-wise. We can see the HRI cases versus suspected heat stroke deaths last year. Next, please. Yeah, that is not related to heat wave. Just last year only, yeah, that was the best practice for flood mock drill with the help of NIDM and SDMA, who had conducted in the mock drill on flood at Hurwa Dam, and simultaneously all districts have been conducted this mock drill in a virtual mode. Yeah, next please. So we can see the different stakeholder department role and responsibility. Yes, this is very important. Ministry of Health has approved this SAPCCHA, State Action Plan on Climate Change and Human Health, in which physical, that means financial budget is also there. There is no any funding issue in the government sector. We are having the surplus. Thing is that planning, how we plan, how we can strengthen our health sector, especially the preparedness of health facility in terms of all the things, logistics, beds, training, IC. These are the some fundamental action plan in the heat-related illness and convergence with the line department. And one of the line department important is IMD disaster management. We know that SDMA Jharkhand is partial functional. It has been well documented in their papers, but still there is issue of manpower, dedicated state district disaster management officers, and also they are having the Abda Mitra, they are having the own that means Abda Mitra training program is there. But they generally, yesterday only we received the SDMA guidelines on only do and don'ts on the heat waves. So they guide all the departments to do your convergence, and as per all responsibility, all departments will work, and deputy and district administration can handle such cases. So from Department of Health side, we have been doing whatever the preparedness, recovery, and response. So in these 3 way, health department is working. So like Panchayati Raj, like school department, urban development, veterinary departments. So this kind of instruction yesterday came from SDMA Jharkhand, but that is not up to the mark. That is in the only guidelines, but how it will be executed, this is the main thing. So health department is the main key department in which district level we have constituted district health level task force committee headed by deputy commissioners. The moment if one meeting will be there in this scorching heat waves from March to June, automatically that means best practices can be done. Adaptations and long-term sustainability plan can be also handles in this period. So this is being conducted in many districts. Next, please. Yeah. This is, as I told in the first slide, multi-sectoral level task force committee at the state level. It was notified last year only. And 4 districts have been submitted to Ministry of Health, district action plan on the climate change manner. Next, please. Yeah, next, man. Advisory has been issued by MD NHM on 28th February this year. Because of the previous year learning and challenges we have, because IHIP reporting is also fundamental things for good data collections in order to minimize the morbidity and mortality. So through IHIP platform, we are having the 821 reporting units, in which presently 232 health facilities have started the reporting for HRI cases, and presently we have only 8 HRI cases were reported from the different districts. So these are the some basic direction in the Hindi towards civil surgeon for dedicated establishment of dedicated stroke room, capacity building, IC, conducting the meeting headed by our deputy commissioners. And important is that higher safety preparedness. This is also one of the mandate, because during summer season, we are having the chances of fire in the different health facility. So NOC clearance from the fire department at district level, that is very, very quite important. So electric load calculation and renewal of the NOC of this fire clearance, that to be taken. So this kind of instructions have been given in this letter, as well also the basic do and do nots in the Hindi, that are also given. Next, please. Yeah, next, please. This is, ma'am, advisory and letters. Yeah. So do and do not through the from the HDMA Jharkhand. That is just simple to one pager, just simple direction that to be implemented, that to be disseminated in the community. So with the help of IPRD department, we circulate this message in the LED screen in the crowded area, as well as in the important areas in which community mobilization is there. So that has been displayed last year, and this year also we will be displaying. Next, please. This is, ma'am, very important, ambulance preparedness. 108 ambulance preparedness, because whenever any HRI cases comes to the health facility, then health facility doctors are well trained that yes, first rapid cooling, then we can transfer to the patient to the health center, because rapid cooling, then transport. So all kind of logistics, right, beginning from rectal thermometer, body, then as well as ice packs, ice cubes, towels, everything in the well in the place, as well as emergency drugs, IV slides, IV ORS packets, all the antihypertensive drugs and antidepressive drugs. So readiness, that means training to the loco drivers, and all the keeping all logistics to ensure it, for keeping all logistics in the ambulance. That letter was last year circulated and it was implemented. Next, please. Next. Yes, this is ambulance preparedness. That has been done last year. And this year again, we have given the training, refresher training to the new agency, because agency have been changed for the conduct for operationalization of 108. So rapid body cooling facility, body bag with cold water or tarpaulin, point of care for test of glucose. These are some basic ice packs, cold towels, ORS, a small flask that is to be kept in the ambulance. Next, please.
Sorry,
Yeah.
Dr. Praveen, sorry to interrupt, but in interest of time, may I
Yes,
request
yeah.
you to maybe
Just
conclude in the next few
I'm
minutes?
skipping, ma'am.
Yes,
Yeah.
yes. We
Just
will
I'm
share the
going, yeah,
presentation with
yeah.
everyone
Please,
present.
ma'am, this is training manuals. Next,
Sure.
please. Yeah. Just, ma'am, skip. This is solar install wood rooftop solar panel and LED bulb. General awareness in Hindi training materials are there. Next, please. Yeah, go ahead, ma'am. No issue. Please skip. Yeah. Skip, ma'am, skip. Yeah, this is some Hindi IC in the different health facility, as well as dedicated heat stroke room. Next, please. Yeah. This is dedicated heat stroke room, ORS corner at different health facility. Yeah, this is training capacity building at block level and district level. Next, please. Yeah, ma'am, go ahead. Yeah, go ahead, go ahead. Next, ma'am, please. Yeah, IMD alerts. मौसम विज्ञान केंद्र in Ranchi, Ranchi weather department is used to forecast the weather events, and we are very close to IMD department. We get it through the email, and accordingly we alert to the districts for to see the trends, and accordingly alerts to the districts. Next, please. So Ranchi, Jamshedpur, and Daltonganj is the most hot districts. Next, please. Yeah. Next. Okay. No need to, yeah. Next, ma'am. Yeah. Next. Yeah, this is important. Public health emergency disaster management professional development program tier 3 with the help of CDC, NCDC and NIDM. And already our Surj Prakash sir has from NIDM, he has emphasized the mitigations plan and NDMA guidelines, etc. So in Ranchi, Jharkhand, this tier three programs conducted in three batches in which representative from the health, from university and disaster. They were participated to understand the response, recovery, preparedness, and mitigations for any kind of disaster. So in which 3 days program, 3 days training program is going to the three batches in which we can mentor mentees program was very successful. So additional chief secretary health, MD NHM, mentors from NDMA, NIDM, HDMA, CDC, NCDC, many were participated. So that was very that means eye openers we can implement across the country. Even it's very successful program. And after mid were also trained behind these mitigations of any heat waves. Next, please. Yeah, this is tier 1, 2, 3, 4. So tier 3 conducted at operational level so that tier 3 trained trainers can disseminate at technical level 2 and community capacity at tier 1. So at grassroots level, health workers can be oriented. Next, please. Okay, next. Yeah, ICLAN is the last. ICLAN, ma'am, we are going to implement aims to foster collaboration across sectors. That means there is a gap, there is challenges to engage with all stakeholders at a time. So this will be the knowledge hub in which ICANN will be established. In Dharwad, it has been implemented, in which all the best practices, documentation of that, collaborations, vulnerability assessment, solution, and capacity building. I see this kind of knowledge hub can be created in forms of integrated climate learning exercise network. Yeah, next, please. This is the rationale. Next. Where does the gap? Yeah, next. Okay. Yeah, next. Last will be the challenges. Yeah, next. Thank you. Yeah. So challenges for Jharkhand state, coordination with other ministries or department is still a challenge. HRI reporting acceptability in areas where heat is not a primary concern is low. Lack of human resources at the smaller health facility to register HRI data. And heat is not a priority in mountains districts because Santhal Pargana having the hot districts, having the mountains, hills, and health and disaster agencies priorities efforts on landslides and precipitation driven extreme events. So these are the some common challenges that is the common across the country. Thank you. This is our last slides, our Twitter, YouTube, websites, and Facebook. Thank you very much.
Thank you so much, Dr. Praveen. This has been a really insightful presentation and documentation of the work being done in Jharkhand. So we'll be sure to share it with all of the participants after the session today. So thank you for that. So next, I would like to invite Ms. Anjali Divakar, who is District Project Officer at East Delhi District Disaster Management Authority, and she also coordinates emergency operations awareness programs and training initiative for DDMA. So Dr. Anjali, Anjali, I'll hand it to you to take the discussion forward.
Yeah, very good afternoon, everyone.
Good afternoon, Anjali. Your article, please go ahead.
My voice is there?
Yes, you're audible.
Yeah. It's
Anjali, there seems to be some network issue. We can't hear you. Your video is also frozen. Maybe if you can try to switch off the video and then try again. Anjali, am I audible to you? There seems to be a network issue at her end. So maybe, Gursimran, maybe you can coordinate with Anjali while we move to the next speaker and we can have her sharing in between. Right. While we wait for Anjali ji to connect, maybe we will move to the next speaker. Firstly, I would also like to thank Deepak ji and Dr. Praveen for sharing their insight, their in-depth experiences from Bihar and also Jharkhand. So next we will be discussing more on policy and governance for heatwave preparedness. So we have our next speaker. We have Ms. Richa Srivastava, who's senior scientist at Integrated Center for Adaptation, Resilience and Sustainability at IIT Roorkee. She comes with 19 years of experience in DRR policy research and climate and environmental sustainability. So Richa ji, I'll hand it to you to talk more about policy and governance for heatwave preparedness.
Thank you, Nupur. Thank you for inviting me for this need of the hour consultation workshop, which is like April has just begun and Delhi NCR is already witnessing intense heat wave. And IMD has also warned that the temperature may rise up to 40 degrees in the central and northern states. So, it's a very important topic to speak upon, and if I start when I was child, I never even heard of a heat wave that could kill people. Back then, if someone had a heat stroke, the solution was simple: drink ampanna and it would be fine. But today things are so different. Every day we are looking for more effective solutions because rising temperatures have made heat waves increasingly fatal. And heat wave, as you may know, that it is declared when the temperature exceeds 40 degrees in plains and 30 degrees in hilly regions. From a scientific perspective, global warming has increased the frequency and intensity of heat waves. And accordingly, according to IPCC, heat waves are one of the major climate risks nowadays. Looking at the critical statistics between 2000 to 2020, the number of heat wave days increased by 50%, which is like just double, and up to 2 to 5 degree temperature has been experienced in the urban heat islands. So, if looking at the severity, the heat waves don't just pose health risks, but they have economic implications also. For example, cooling systems drive up energy cost, workforce productivity drops outdoor, and critical infrastructures like roads, railways, and airports are under strain. So the effect are pervasive. And there is a study which shows that every 1 degree rise in classroom temperature decreases students' learning ability by 1%. Isn't it alarming? So, in today's consultation, I am supposed to speak on strengthening early warning system and public alerts, importance of interagency coordination, and urban planning and infrastructure resilience. Talking about the early warning, our first three-tier system at national, regional, and local level is crucial. Incorporating artificial intelligence and advanced technologies can enhance efficiency, but multi-stakeholder cooperation in early warning is the key. For example, if government agencies, private sectors, and community come together, the impact will be more greatly significant. If I elaborate, I would say that government agencies at national, state, and regional level with synchronization will be more effective than more effective and problem solving. And similarly, engaging private sectors, just technological tech companies or telecom providers or media outlets that can help in disseminating alerts to the community. And community level in volunteers can be instrumental in making alerts accessible, which is accessible to everyone, even in the regional languages. And who is the nodal for heat waves? They have been regularly issuing advisories on heat waves to all heat wave prone states and union territories. These advisories also contain provision of safeguarding animals. Ultimately, strengthening early warning system and public alerts for heat wave is multi-layered effort, which will require innovative technology, collaborative governance, and active community engagement. And by prioritizing these strategies, we can significantly reduce the adverse effect of heat waves, protect vulnerable populations, and enhance overall resilience to the climate change. If we talk about effective response from NDMA, the NDMA Government of India has few priority actions, which include number one, understanding the disaster risk. Number two is strengthening the disaster risk governance, where they include the interagency coordination. Number three, investing in disaster risk reduction. And four is enhancing preparedness for effective response. This is the major four important points which NDMA guideline says to incorporate. The Government of India also drew a action plan for prevention and management of heat wave in 2016, and it was I think revised twice in 2017 and 2019, which is a very good reference document. Looking at the interagency coordination, the role and responsibilities of agencies at national, state level should be well defined and synchronized. For example, giving the example for heat waves, NDMA coordinates with organizations like IMD, Ministry of Earth Sciences, Integrated Disease Surveillance Program of NCDC under Ministry of Health and Family Welfare, and other concerned ministries and departments. So this combined action taken by central and state governments, district administrations, forecast department, health department, and society, civil society, they result into a significant reduction in the casualties. So the interagency coordination is very important, very, very important. And if you can take up any plan, any action plan, you will find it that this is the key to the solution of the problem. Lastly, if I want to talk, I want to talk about the increasingly pressing issue, which is planning of extreme heat challenges in our cities. This is an urgent task for urban planners, designers, and managers because urban heat is no longer an occasional occurrence. It has become a new normal climate related challenge for many cities around the world. Researchers are actively exploring solutions focusing on heat resilient infrastructure systems and urban heat management plans to mitigate the rising problem. Some of the practical strategies being implemented and proposed. For example, one effective approach is urban greening, which includes the development of parks, gardens, rooftop gardens, tree-lined streets. These green streets and spaces serve as a natural cooling system, which reduces the temperature in urban areas. They not only combat heat, but also enhance the quality of urban living by promoting biodiversity and improving air quality. Another good example is cool roof technology, which have proven to be another impactful solution. In this technology, they generally use reflective coating and materials on roof, which reflects sunlight and reduces the heat absorption and lowers the overall temperature in urban environment. One of the great example of cool rooftop program implemented under the Ahmedabad Heat Action Plan in 2017. This initiative taken by the Gujarat government in collaboration with some NGOs demonstrated a measurable success in mitigating urban heat impacts, which can be taken as an example. Another critical strategy is the design of the ventilated housing. Here, urban planners and architects play a pivotal role where the homes can be designed to enhance natural airflow by incorporating intentional window placements and ventilation systems. Features like courtyards, although it's a luxury in densely populated urban areas, can significantly improve the air circulation and reduce indoor temperatures. And our simple adjustments can have a profound impact on our living conditions. In addition to above, this promoting green and heat resilient infrastructure is essential. Enhancing urban planning and including natural shading, developing green spaces, and integrating climate conscious design elements can serve as a form of therapy for the cities suffering from extreme heat impacts. To conclude, addressing extreme heat challenges requires a multi layered approach. It requires heat wave preparedness into urban policies, practices, and organizational frameworks. With this approach, we can safeguard communities from adverse effect of rising temperature. And this not only involves innovative infrastructure, but also collective commitment of the government, private sector, and local communities. By prioritizing these strategies, we can make our cities more resilient to climate change and ensuring a better future for the urban population. And as Dimji sir has said that it is completely preventable, heat wave can be tackled, and there are action plans. We have a heat action plans. Every state has a heat action plan. The only problem is there's no effective implementation. We must focus on the implementation uh, because it is a strategy to tackle the disaster. So if we focus on that, we will definitely be successful in our endeavor. Thank you so much.
Thank you so much, Dr. Recha. So, I think your
Yeah,
points have set.
Dr. Nupur, just sorry for interrupt you.
Yes,
Dr.
Dr.
Nupur, I am leaving now because I have to join other meeting. Shall I leave? If you give me permission,
Sure, Dr. Praveen.
if you allow
And
me, then I can
if
leave.
there are
Okay.
any specific questions, we will reach out to
Yeah,
you
sure, sir.
personally. All right.
Sure,
Thank you,
madam.
Dr.
Thank you.
Praveen.
Okay.
And thank you, Rajaji, for your points. They have definitely set the tone for deeper reflection and also action moving forward. So thank you for that. I think we also have Dr. Anjali ji join. Anjali, if you can confirm if I'm audible and you're able to join
Yeah,
now.
you are audible now.
Yes,
Even
yes.
I'm
Okay.
audible or not?
Yes, yes, you are, please. So I'll hand it to you to share your reflections from experiences in Delhi.
Yeah. Thank you very much, Nupur. Actually, Richa ma'am have covered my points also by giving the all the things how this integrating heat waves resilience into the urban planning. But it's very true. We should have we should develop some kind of a plan which is involving the physical infrastructure plus the urban designing. As she said, green infrastructure should be there because the combinations of the physical and infrastructure changes can with the social and institution strategy to mitigate the heat impact and enhance the community preparedness. Early warning, green roof, cool prevention. Like now in the urban cities, we are only finding the concrete jungle. We don't have any kind of thing with a greenery, and the buildings over here are multi-story, but without a fire NOCs, without the fire NOCs and all early warning. But the thing is that key if these multi-story building have the green roof, utilize the green roof to reduce the urban heat, it's a very effective and improving energy efficiencies. Buildings to be designed in the compact and the middle rise buildings to with a light color, not to be of very dark color to be there, which can you give a cool effect. And if we talk about the Delhi में जो सबसे बड़ा problem है, it's the traffic and the congestion. When the traffic is very high, it's also produced to the heat. And even the Delhi has developed its heat action plan. And
Anjali ji, are you still there? Anjali ji?
yeah, I'm audible.
Yes, now you are.
Like early warning system, we have the community engagement, the vulnerable population to be known, a cooling center to be established, proper utilization. Delhi has a problem of they don't have get the proper water also. So all the
And I'm not sure if it's a network issue, but we've lost your voice. We can't hear you anymore. I think there seems to be a network issue on Anjali's end. So maybe while she did share on challenges in urban areas and also shared about initiatives to address urban heat island impact, maybe we can have her come back towards the end of the session if the network allows, or maybe we can have her document her learnings in the chat at a later stage. Maybe moving forward to the next speaker. So I'd like to next invite Ms. Divya Gupta, who's Associate Director at SEEDS. And as we know, she's led response to multiple disasters and also drives the advocacy partnership and inclusive climate resilience initiatives at SEEDS India. So Divya will be sharing about localized strategies for community-led heatwave preparedness. Divya, I'll hand it to you now.
थैंक यू नूपर, थैंक यू सो मच एंड थैंक यू फॉर दिस अपॉर्चुनिटी। तो मैं अपना जो बात है मैं इस पे पूरा फोकस रखूंगी कि कैसे हम पर्टिकुलरली लोकलाइज्ड स्ट्रेटजी को इंश्योर करें जब हम हीट वेव एक्शंस की बात करते हैं। तो सबसे पहला पॉइंट इसमें ये है कि हमें लोकल वल्नरेबिलिटी को समझना पड़ेगा। जिन जिन एरियाज में जिन जिन स्टेट्स में हीट वेव का इम्पैक्ट होता है, वहां पे रहने वाली हर फैमिली और हर इंडिविजुअल अलग तरह से अफेक्ट होता है। जैसे अगर हम देखें, एक फार्मर है तो वो इस तरह से अफेक्ट होगा, उसकी क्रॉप पे फर्क पड़ेगा, उसका इनकम का फर्क पड़ेगा। एक स्टूडेंट है, उसके लर्निंग डेज में फर्क पड़ेगा। अगर एक लेबर है, उसके वर्किंग डेज कम हो जाएंगे या उसको काम नहीं मिलेगा, या अगर उसका एम्प्लॉयर उस तरह की फैसिलिटीज उसे नहीं दे पाता है उसके वर्किंग प्लेस पे। एक विमेन है, उनको पानी का क्राइसिस है, काम पर जाने के लिए डिफिकल्टी है, या फैमिली में जो इनकम कम आ रही है उसमें कैसे मैनेज करना है उसमें उनकी डिफिकल्टी है। तो हर एक इंडिविजुअल पे हीट वेव का अफेक्ट अलग तरीके से होता है। तो सबसे पहले हमें ये समझना पड़ेगा कि लोकल वल्नरेबिलिटी क्या है। जो जिन कम्युनिटीज के साथ हम काम कर रहे हैं उनकी वल्नरेबिलिटीज क्या है, किस तरह से हीट वेव उनको अफेक्ट करता है। हर एक को यूनिक वे में अफेक्ट करता है हीट वेव, तो वो फैमिली लेवल और इंडिविजुअल लेवल पे हमें समझना पड़ेगा और उसी हिसाब से हमारा जो एक्शन है वो हमें डिजाइन करना पड़ेगा। और इम्पॉर्टेंट बात ये भी है कि जब हम उनकी वल्नरेबिलिटी को समझे तो हमें ये भी देखना पड़ेगा कि हमारे एक्शन पॉइंट क्या क्या हो सकते हैं। कैसे हम पानी को की अवेलेबिलिटी को इंश्योर करें, कैसे हम जो एम्प्लॉयर्स हैं उनके साथ ये नेगोशिएट करें कि वो काम की टाइमिंग को चेंज करें, या काम की जो वर्किंग प्लेस है उन पे फैसिलिटीज जो मिलनी चाहिए काम करने वालों को उन वो मौजूद कराएं, या इंफ्रास्ट्रक्चर उनका वर्किंग प्लेस पे इस तरह का हो जिसमें हीट वेव के इम्पैक्ट को कम से कम किया जा सके। कूलिंग स्पेसेस हो जहाँ पे लोग बैठ सके, आराम कर सके। अगर किसी को अगर हीट वेव की वजह से बीमार होता है तो उसको इमीडिएटली मेडिकल असिस्टेंस जो चाहिए उसको प्रोवाइड की जा सके। और इसके अलावा एक इम्पॉर्टेंट बात यह है कि डेटा होना बहुत इम्पोर्टेंट है, कि हमें ये देखना पड़ेगा कि पिछले कुछ सालों में किस तरह से, किस सिटी में, किस एरिया में, किस डिस्ट्रिक्ट में हीट वेव ने किस तरह से अफेक्ट किया। तो हमारी स्ट्रैटेजी को हम हमारा जो पिछले 2-3 साल का या 5 साल का जो हिस्ट्री है उसको ध्यान में रखते हुए, और वल्नरेबिलिटी क्या है पर्टिकुलर पॉकेट्स में, पर्टिकुलर इंडिविजुअल्स की, उसको ध्यान में रखते हुए हमें पूरा, और लोकल जियोग्राफी कौन सी है, अर्बन और रूरल का स्ट्रैटेजी सेम नहीं हो सकता, कोस्टल का और इनलैंड का स्ट्रैटेजी सेम नहीं हो सकता, तो लोकल जियोग्राफी क्या है उसको ध्यान में रखते हुए हमें उनके लिए स्ट्रैटेजी बनानी पड़ेगी। दूसरा चीज इंपॉर्टेंट ये है कि कम्युनिटी का इन्वॉल्वमेंट, पूरा जो हमारा अवेयरनेस कैंपेन है उसमें होना जरूरी है, अदरवाइज हम लास्ट माइल तक हम नहीं पहुंच पाएंगे। जैसे कि हमारे जो कम्युनिटी सर्विस प्रोवाइडर्स हैं, जो हमारे ग्रास रूट फंक्शनरीज हैं, उनका इन्वॉल्वमेंट, उनका जो अपना एक नेटवर्क होता है, अगर हम देखें तो आशा वर्कर का अपना एक नेटवर्क है, एएनएम्स का अपना एक नेटवर्क है, यहाँ तक कि बहुत सारे जो लेबर ग्रुप एरिया वाइज होते हैं उनका भी अपना एक फोरम होता है, अपनी जो लेबर उनकी कमेटीज होती हैं। तो इस तरह के जो नेटवर्क्स हैं उनको हम टारगेट कैसे करें, उनको इन्वॉल्व कैसे करें अवेयरनेस कैंपेन में, ताकि जो अवेयरनेस नॉलेज इंफॉर्मेशन है वो लास्ट माइल तक पहुंच सके, कि उनके लोकल लैंग्वेज में किस तरह का आईईसी उनको समझ में आता है, कौन सा डायलेक्ट वो यूज करते हैं, या उनके पास कौन कौन सी फैसिलिटीज अभी मौजूद हैं जिनके हिसाब से उनको हम अवेयर कर सके। इसके अलावा जो है लोगों तक ये इन्फॉर्मेशन पहुंचाना बहुत जरूरी है, क्योंकि जैसा अभी ऋचा मैम ने भी बोला था कि हमने अपने अपने जो हमारा जो पुराना टाइम है, हम लोगों ने हीट वेव का इस तरह का इम्पैक्ट कभी नहीं देखा, और जब हिस्ट्री में हमने इम्पैक्ट नहीं देखा तो हमारी समझ भी इस तरह की होती है कि यार इससे कुछ नहीं होता, धूप में निकलने से इतना कोई प्रॉब्लम नहीं होता, या गर्म इससे कोई प्रॉब्लम नहीं होता। तो लोगों को उस कितना डेंजर हो सकता है उस लेवल का उनको बताना बहुत जरूरी है, उसका इम्पैक्ट किस सीवियर लेवल तक पहुंच सकता है वो बताना बहुत जरूरी है, या कौन कौन से साइन सिम्टम्स है जिससे वो समझ सके कि कोई व्यक्ति को अगर जो अफेक्ट हुआ है वो हीट वेव से अफेक्ट हुआ है, और किस तरह से छोटे छोटे जो डिसीजंस हैं या छोटी छोटी प्रैक्टिसेस हैं उससे वो इन टेम्परेचर को कम कर सकते हैं। मान लीजिए कि कूल रूफिंग है, या थोड़ा दिन के टाइम में अपने काम का टाइम को चेंज करके इंडोर एक्टिविटीज में ज्यादा अपने टाइम को लगाए। तो छोटे छोटे जो एक्शंस हैं, प्रैक्टिसेस है, उससे वो कैसे बच सकते हैं। और इसके अलावा जो लोकल लीडर्स हैं उनके साथ कोलैबोरेट करके वो इन्फॉर्मेशन को लास्ट माइल तक पहुंचाना। और तीसरा पॉइंट मुझे लगता है कि हमारा पूरा की पूरा हीट एक्शन प्लान टेलर्ड मेड होना चाहिए, कस्टमाइज होना चाहिए, जियोग्राफी वाइज, अर्बन है, रूरल है, कोस्टल है या इनलैंड है। दूसरा चीज वहां के लोगों का लाइवलीहुड किस तरह का है, वर्किंग टाइमिंग्स किस तरह की हैं, वहां की कम्युनिटी सर्विसेज किस तरह की हैं, उसको ध्यान में रखते हुए पूरा की पूरा हमारा हीट एक्शन प्लान बनना चाहिए। और जो प्रोटोकॉल्स हैं कूलिंग सेंटर्स के, वो भी लोगों तक पहुंचने चाहिए, क्योंकि बहुत सारे ऐसे लोग भी होते हैं, जैसे मान लीजिए रिलीजियस ग्रुप हैं या बहुत सारे स्पिरिचुअल ग्रुप हैं, जो कुछ ऐसा अरेंजमेंट करना चाहते हैं कि ठीक है हमारे मंदिर में खाली जगह है, खाली हॉल है, जिसको हम लोग माइग्रेंट लेबर को हम प्रोवाइड कर सकते हैं, वो लोग आके वहां आराम कर सकते हैं, बैठ सकते हैं दोपहर में। तो उनको उनको ये अवेयरनेस देना कि इसके प्रोटोकॉल्स क्या हैं, कैसे वो अपना जो एग्जिस्टिंग इंफ्रास्ट्रक्चर है उसको वो एक कूलिंग उसमें कन्वर्ट कर सकते हैं, सेंटर में कन्वर्ट कर सकते हैं। वाटर डिस्ट्रीब्यूशन कितना इंपॉर्टेंट है ऐसी लोकेशंस पे जहां पर लोग ट्रैवल करते हैं, रुकते हैं, जाते हैं। ओआरएस का होना इंपॉर्टेंट है वहां पे। जैसे मान लीजिए बहुत जगह पे हम छाछ या शरबत इस तरह का भी कुछ प्रोविजन सोच सकते हैं। और जब हम बात करते हैं लोगों की, तो सिर्फ वो लोग नहीं जो कम्युनिटी के लोग हैं, वो लोग भी इंपॉर्टेंट है जो कम्युनिटी को सर्विसेज प्रोवाइड कर रहे हैं। ट्रैफिक पुलिस में जो लोग काम करते हैं वो दोपहर में भी रोड पे खड़े होते हैं। आंगनवाड़ी वर्कर जब घर घर जाके कुछ सामान बांट रही होती है, आशा वर्कर सर्वे कर रही होती है, एएनएम जाके टीका लगा रही होती है। तो सर्विस प्रोवाइडर्स को भी की भी हमें ध्यान रखनी है, जो हमारे लास्ट उसपे कम्युनिटी को सर्विस प्रोवाइड करते हैं। क्योंकि अगर वो खुद उनका हेल्थ खराब होगा तो वो कैसे कम्युनिटी को सर्विस प्रोवाइड करेंगे। और जब भी हम कोई जो प्लान बनाते हैं ना, प्लान हमारा इतना लेंदी नहीं होना चाहिए कि वो बड़ा खूबसूरत सा एक डॉक्यूमेंट हो, जो एक एक जो कॉमन पर्सन है या जो हमारे जो पूरा फंक्शन है, डिपार्टमेंट है, उसमें जो हमारे नीचे के तबके के जो स्टाफ है उनको समझ में ही नहीं आई। वो इतना सिंपल होना चाहिए कि बहुत उनको समझ में आ जाए कि हमें क्या क्या एक्शन लेने हैं, कैसे काम करना है, क्या क्या प्रोटोकॉल्स है, और इन केस किसी को अगर मेडिकल असिस्टेंस की जरूरत है तो कैसे पहुंचाई जा सकती है। और बहुत वाइडली एक्सेसिबल होना चाहिए, सब तक वो प्लान पहुंचना चाहिए, तभी लोग उसको यूज कर पाएंगे। बहुत बार ऐसा होता है कि प्राइवेट और गवर्नमेंट के बीच में भी एक गैप है कि गवर्नमेंट ने बहुत अच्छा प्लान बनाया है, पर प्राइवेट में जो लोग भी वो सर्विसेज प्रोवाइड कर सकते हैं, उनको वो पता ही नहीं है कि वो उनके इंफ्रास्ट्रक्चर या उनके पास जो भी CSR का पैसा है या डोनेशन का पैसा है, उसको इस काम में यूज कर सकते हैं। तो कैसे वो प्लान को हम बहुत सिंप्लीफाई करके ज्यादा से ज्यादा लोगों तक पहुंचाएं, ताकि वो उसको यूटिलाइज करके लोगों तक सर्विसेज को पहुंचा सके। और जब हम बात करते हैं तो इसमें सिर्फ ये इम्पोर्टेंट नहीं है कि एक नॉलेज, इंफॉर्मेशन या कैपेसिटी लोगों तक पहुंचे, उन एक फीडबैक सिस्टम भी होना चाहिए कि वो कैसा फील कर रहे हैं या उनका एक्सपीरियंस क्या हुआ हीट वेव में, वो भी पॉलिसी मेकर्स तक पहुंचना चाहिए, ताकि वो भी नेक्स्ट टाइम अपनी पॉलिसी में उन चीजों को इंक्लूड करे। तो बहुत डुअल वे सिस्टम होना चाहिए। और इसमें हमें ये बहुत है कि अर्बन लेवल पे ज्यादा हीट वेव का इफेक्ट होता है, क्योंकि लोगों को घर के बाहर निकलना पड़ता है काम करने के लिए। तो अर्बन लेवल पे कैसे हम कूलिंग सेंटर्स बनाएं, जहां जहां भी लोग कहीं वेट करते हैं या जहां पे भी ओपन साइट्स है जहां लेबर्स काम करते हैं, वहां पे फैसिलिटीज प्रोवाइड करें, पानी प्रोवाइड करें, ORS प्रोवाइड करें, छाछ शरबत प्रोवाइड करें, और लोगों को ये नॉलेज इंफॉर्मेशन दे कि वो अपने आप को कैसे बचा सकते हैं, और इन केस उनको अगर हीट वेव का इफेक्ट होता है तो कैसे वो मेडिकल असिस्टेंस ले सकते हैं। इसके अलावा हमारी जो बिल्डिंग की डिजाइन है, उसमें बहुत खर्चा भी नहीं आता, लेकिन सिर्फ नॉलेज वाली बात है, इंफॉर्मेशन वाली बात है कि कैसे लोग कम से कम 2 डिग्री तक का टेम्परेचर उसमें कम कर सकते हैं। तो उनको कैसे कूल रूफिंग है, थर्मल इंसुलेशन है, शेड बनाना है, बहुत कम खर्चे में वो अपना उसको पूरा कर सकते हैं। तो और इसके अलावा जैसे मान लीजिए बहुत सारे ऐसे स्लम एरिया हैं जहाँ लोग अगर उसको नहीं अफोर्ड कर सकते हैं, तो जो भी ग्रुप वहाँ काम कर रहे हैं, बहुत सारे स्लम्स में CSR बहुत काम करते हैं, तो जो एग्जिस्टिंग CSR उस एरिया में है, उनको सिर्फ आप वो टेक्निकल डिजाइन दे दो कि आप अगर इसको सपोर्ट कर दो इन कम्युनिटी को, तो बहुत अच्छा होगा, और वो बहुत हैप्पीली उसको एक्सेप्ट करेंगे और करेंगे, क्योंकि वो ऑलरेडी वहाँ काम कर रहे हैं, और उनके लिए वो छोटा सा बजट मुश्किल भी नहीं है करने के लिए। और कैसे हम पब्लिक स्पेसेस को बहुत ज्यादा फ्रेंडली बनाएं, थोड़ा शेडिंग करके, मान लीजिए बस स्टॉप है और वहां पानी का फैसिलिटी प्रोवाइड करके कूलिंग जोन्स बना के कैसे उसमें हम कर सकते हैं। और लोगों को हम ये, जो लोग भी रिलीजियस या किसी भी तरह के उससे जुड़े हुए हैं, सर्विसेज से जुड़े हुए हैं, उनको हम ये इनकरेज करें कि वो अपने अपने लेवल पे लोगों को सर्विसेज प्रोवाइड करें। और कैसे हमारे जो कूलिंग सेंटर्स है वो एक्सेसिबल बनाएं। बहुत बार कूलिंग सेंटर अवेलेबल है, पर जो लोगों को जरूरत है उन्हें बेचारों को पता ही नहीं है कि कहाँ पर है। तो कैसे हम वो इंफॉर्मेशन को स्प्रेड करें, कैसे उस उनके लिए एक्सेसिबिलिटी इंश्योर करें, कैसे एडमिशन इतना सिंप्लीफाई करें कि इजीली जो बंदा पढ़ा लिखा भी नहीं है या जिसको इन्फॉर्मेशन ज्यादा नहीं है, वो भी इजीली वो सर्विसेज को अवेल कर सके, कूलिंग सेंटर में जाके रेस्ट कर सके। तो ये बहुत इंपॉर्टेंट है, उनकी एक्सेसिबिलिटी को बढ़ाना, जो ऑलरेडी इंफ्रास्ट्रक्चर है वहां पे। तो बहुत पब्लिसिटी करना इंपॉर्टेंट है इसके लिए। और इन केस अगर कुछ ट्रांसपोर्टेशन फैसिलिटी उनके लिए हो सकती है कि अपनी साइट पे जहां पर वो काम कर रहे हैं, वहां से वो कूलिंग सेंटर पे या रेस्ट हाउस जो भी क्रिएट किया गया है वहां तक वो जा सके। जैसे मुझे याद है 1 साल पहले या 2 साल पहले दिल्ली में लेफ्टिनेंट गवर्नर ने एक डायरेक्टिव इशू किया था कि उनको जो लेबर्स हैं उनको पेड मिड डे ब्रेक दिया जाए। जितने भी एम्प्लॉयर्स हैं, जितने भी प्राइवेट एम्प्लॉयर्स हैं या गवर्नमेंट एम्प्लॉयर्स हैं, उनको अपने सभी लेबर्स को पेड मिड डे ब्रेक देना पड़ेगा। तो कहीं ना कहीं ऐसे छोटे छोटे डिसीजन लोगों को काफी हेल्प करेंगे अपने आप को हीट वेव से बचाने के लिए। नुपुर, जस्ट नीड 30 सेकंड्स, जस्ट नीड 30
Sure,
सेकंड।
sure.
इसके अलावा जो हमारी वल्नरेबल पॉपुलेशन है उनको में हम कैसे हीट रेजिलियंस को इम्प्रूव करें, इंफ्रास्ट्रक्चर वाइज, नॉलेज वाइज, और इसके अलावा उनके पास हम कुछ सब्सिडाइज, कुछ इंफॉर्मेशन सब्सिडाइज, सॉरी बाय मिस्टेक आई, तो उनको कैसे हम कुछ तरह की सब्सिडी प्रोवाइड करें ताकि वो जो उनका इनकम का लॉस इस दौरान हो रहा है उससे वो अपनी फैमिली को रन कर सके। और एक बात बहुत इंपॉर्टेंट है, वो है अर्ली वार्निंग। अर्ली वार्निंग को हमें ये चीज बहुत ध्यान रखना है। हम लोगों को ये तो बताते हैं कि क्या होने वाला है, लेकिन उस सिचुएशन में वो अपने आप को कैसे बचाए, वो एक्शनेबल आइटम भी उसमें इंक्लूड करना जरूरी है, जिसमें नॉन प्रॉफिट ऑर्गेनाइजेशन, सीएसआर, हमारे जितने वॉलंटियर ग्रुप है, वो इसमें बहुत अच्छा रोल प्ले कर सकते हैं कि अगर टेम्परेचर इतना बढ़ रहा है तो आप अपने आप को उस सिचुएशन में कैसे बचा सकते हैं। तो जो एक्शनेबल जो आइटम्स हैं, उसके जो एक्शनेबल इंडिकेटर्स हैं, उनको कैसे हम लोगों तक पहुंचाए, ये काम करना भी जरूरी है। और लोगों के खुद के फीडबैक भी लेना जरूरी है कि जब उनके एरिया में हीट वेव है तो वो अपने आप को कैसे बचा पा रहे हैं या क्या किस तरह की प्रॉब्लम फेस कर रहे हैं, ताकि पॉलिसी जो होल्डर्स हैं वो उसमें काम को इंक्लूड कर सके। इसके अलावा जो है टारगेट कम्युनिटी सपोर्ट नेटवर्क को हमें यूज करना है। जैसे मान लीजिए कि लेबर्स के अपने ग्रुप होते हैं, रेजिडेंशियल सोसाइटीज के अपने नेटवर्क होते हैं, बहुत सारे कास्ट बेस्ड ग्रुप भी होते हैं। जैसे मैंने गुजरात में बहुत देखा है कि जैसे पटेल कम्युनिटी के अपने नेटवर्क हैं, हर एक कम्युनिटी के अपने नेटवर्क हैं। तो उन नेटवर्क को हम कैसे यूटिलाइज करें, दो चीजों में, एक तो जो नॉलेज है, इंफॉर्मेशन है, उसको हम लास्ट माइल तक पहुंचाएं। दूसरा चीज, उनके पास जो अवेलेबल इंफ्रास्ट्रक्चर है उसको कैसे हम कन्वर्ट करें, जो कि हीट वेव से अफेक्टेड लोग उसको यूटिलाइज कर सके। तो दोनों तरीके से उन नेटवर्क्स का यूज हम कर सकते हैं। और एक बड़ी सिस्टम में हम उसको ला सकते हैं कि आपके पास इंफ्रास्ट्रक्चर है और कुछ लोगों को उस इंफ्रास्ट्रक्चर की जरूरत है, तो कैसे आप एक भाईचारा रखें और लोगों तक वो सपोर्ट पहुंचाए। और टेक्नोलॉजी का यूज बहुत अच्छे से इसमें किया जा सकता है। इंडिया में अगर देखा जाए तो टेक्नोलॉजी का यूज हम, मतलब मुझे कभी कभी ये लगता है कि लोग अगर रील बनाने में टेक्नोलॉजी का यूज कर सकते हैं, फन के लिए यूज कर सकते हैं, तो हम जान बचाने के लिए क्यों नहीं यूज कर सकते। कैसे हम मोबाइल, व्हाट्सएप या छोटे छोटे वीडियो बना के वो अवेयरनेस लोगों तक पहुंचा सके, ताकि वो अपने आप को प्रोटेक्ट कर सके। तो ये मुझे लगता है बहुत जरूरी है, जिसमें हम अर्ली वार्निंग को भी और कैसे अपने आप को प्रोटेक्ट करना है उससे रिलेटेड अवेयरनेस भी उन तक पहुंचा सकते हैं। तो ये मुझे लगता है कि ओवरऑल चीजें होनी चाहिए जब हम लोकल लेवल पे बात करते हैं लोगों को प्रोटेक्ट करने के लिए हीट वेव से। थैंक यू नुपुर।
Thank you
और
so much,
एक और चीज है, वो है साइको सोशल सपोर्ट। क्योंकि जब किसी का अगर काम छूट रहा है, लोग अगर दिन में काम करने नहीं जा पा रहे हैं और उस वजह से काम कम कर पा रहे हैं या पैसा कम आ रहा है या किसी भी तरह की डिफिकल्टी को फेस कर रहे हैं, तो कहीं ना कहीं एक बहुत एंग्जाइटी क्रिएट होती है लोगों के बीच में। तो कैसे उनको साइको सोशल सपोर्ट भी प्रोवाइड किया जाए, ताकि उनको ये समझाया जाए कि आपकी जान बचाना बहुत जरूरी है और कैसे दूसरे तरह के जो सप्लीमेंट्री काम है उनसे आपको जोड़ा जा सके और आप जो है आपकी इनकम को वापस ठीक किया जा सके। थैंक यू नुपुर।
Thank you so much, Divya ma'am. Thank you for grounding this discussion with such meaningful insights, especially that we need to focus on community-focused and community-led action. So thank you for that sharing, Divya ma'am. So moving on, a couple of speakers before briefly mentioned about the impact of heat waves on animals. So our next speaker will be elaborating on the same. So we have Mr. Praveen, who's Manager for Disaster Preparedness at the UN World for Animals India, and he champions animal inclusive disaster response and policy integration across India. So Praveen will be elaborating a bit on protecting animals from extreme heat, reflecting on challenges and solutions. So Praveen, with that, I hand it to you.
Thank you, Nupur. Thanks for the opportunity. I don't know how am I going to keep up the energy of Divya, a wonderful speech, Divya, and great to see how SEEDS is progressing with heat wave preparedness and actively using AI to understand the heat wave risk also. Awesome work. Thank you so much for that. And like Nupur, you have rightly mentioned, I was glad to see many speakers are talking about animals as well. The heat wave action plans are mentioning animals now. It was not the case 2 years back, but we are more humane now, I feel like. And yeah, talking about animals and heat waves, this is something which we have been focusing now for some time. And So like what you can see, thanks for sharing. What you can see in the picture, we prepare multiple materials and do capacity building programs with the community using methods like impact based or like in with the involvement of the community, training programs and all, to see what you can do within your existing capacity to avoid the risk of yourself and your animals getting affected by the risk of heat waves. So these are the kind of symptoms you see when it comes to heat waves and animals. Here I have focused more on companion animals and livestock for the larger audience, and the animals. We should take responsibilities of these animals. So for our own pleasure and companionship and economic benefits, we take care of these animals, and it's our responsibility that their welfare is ensured. Mainly the companion animal, let's say dogs, cats, the exotic birds you have at your home, are affected by heat stress, heat stroke in many ways. Dogs, if you see symptoms of like high panting, like they regulate your body temperature through panting. So many dogs who are not of native breeds, like pugs or bulldogs, etc., face a lot of issues during heat waves to breathe also. So for pugs, breathing in during normal time is also a very difficult job, uh, thanks to the extreme breeding technologies used to make a big dog to that small size. But yeah, it's really a cruel practice towards that dog. But these animals face a lot of stress even to breathe during a heat wave or when the temperature rises. And when you go out with your animals for a walk and all, like their pugs getting it like unbearably hot, and it can also damage the animals and increase their stress levels. Stray animals are not yet adapted to the extreme conditions now, but they know how to find their shelter. But if seen shelter is not available for the animals, please offer a helping hand if you can. And dehydration and reduced appetite is something you will see in your animals. If you have pets at your home, you might see during this time they might be eating less than their usual schedule. This is because when you eat, the digestion process emits some heat, and that's again increase the overall heat of your body, and animals tend to eat less during that time. And dehydration is a very common symptom, so please make sure your animals are drinking water more than on normal times. And heat creates a favorable condition for tick and flea infestations, which can actually cause severe skin infection for your animals. So make sure you are visiting your veterinarian and see if there are such symptoms arriving. These are the symptoms you can actually see by your own. If your dog is panting more than usually, you will see that. And if your dog's nose or a cat's nose, or even your cow, if you have livestock at your home, nose is dry, it should never be dry. It should always be wet. So these are some basic symptoms you can see to see if your animal is in a good, healthy condition or not. And birds are very not much cared for. You'll see poultry farms and all, and how they are arranged, the system of having a lot of birds in a very limited confined space, even battery cages for egg laying hens and all. And the facility becomes so hot that these animals often suffer, and mass culling is necessary because of the infestations and spread of diseases and all. Because during summer only you see a lot of such poultry related diseases also. So ensuring these animals are at a good state is our responsibility. And coming to farmed animals, heat stress in dairy cattle and such big animals is also very huge, because the larger the size of the animal, the higher the chance of getting heat stroke or heat related issues. So making sure they are properly under shade and enough provisions are provided to them to safeguard their safe well-being is necessary. And monitoring respiration rate is important in farmed animals also. It is very simple yet but powerful tool for early intervention. Always look at the respiration rate of your animals. And then mass mortality in poultry, like I said, happens during this time. And often during summer season, places with prolonged drought and symptoms of heat waves also, farmers tend to sell their cattle because they are not able to provide enough food and nutritious food to their animals, and they often try to sell their cattle with a lot of vendor pressure, but there are no other way. They know that animals won't survive if it is not taken care of. And a lot of deaths happen due to the transportation of these animals in human ways. There are certain rules and regulations in the Prevention of Cruelty Against Animals Act, even transportation rules. If you see that to move an animal, there should be a proper space available in the truck, and it should be fully covered. And in a day, this is the amount of kilometer the animals should be traveling. Especially during this time, adhering to these standards are really important. So it's our responsibility that we share this information and make sure that these rules are also taken care of. And one myth or one thing we do not maybe we don't know that, like when it animal is panting and you feel like it's having a heat stroke or something, bathing an animal could be a good solution, we feel like. But bathing animal during daytime in such a summer is actually going to do the exact opposite. The humidity in the animal's body will increase, and that will essentially cause heat stroke to the animal, and animal can even die. So bathing an animal is something different, and putting making an animal sit on a bowl of water or near a pond like how buffaloes does is again different. You are in that area for a longer time where your body cools, but bathing is entirely different. So please, we should be careful on such matters also. And if you see, I have written some do's, don'ts, and can you go back to the earlier slide? Behind, picture. And next one. One more slide is there. Okay, it's okay. So basically, these IEC materials help us reach out to the community in a very like relatable manner. These are the kind of things they can relate to, and this is not say the social media posters. So we generally post these materials in public utility areas. Public transports, we paint these things in walls like murals and things like that. Using community radios, we conduct like recording sessions in multiple languages, and a lot of tribal languages also included, because that's again one another area we often tend to ignore. And over 60% of these animals, farmed animals, are located in the most vulnerable areas of India, who are taken care by the pastoral, marginal, and poor farmers of our country. And they tend to have a very good connection with these animals. One is the connection of companionship. Second is the livelihood support they get with their animal. So if losing that animal, means losing that animal means losing that companionship and increasing the mental health impact of that loss, and also a financial instability. Therefore, to look at disaster risk reduction in a perspective of animals is also important. So animal inclusive disaster risk reduction should be something we is something we ought to give more importance to when we think about larger policies and plans at country level, state level, and district level. So some of the urgent steps we can do within our existing capacities and NGOs, individuals, and community-based organizations are ensuring water access to these animals. Like how my previous speakers have also mentioned, make sure community water trusts are there for these animals to come and have some water, and provide shaded areas for these animals. You can use locally available materials, like for example in Kerala, we use coconut leaf. Palm leaves are used in some other places. Wheat straws are used to make shelters in some other places also. So such temporary establishment can be made. The reason why I'm saying this, in a lot of rural areas, people do not have the luxury to build a shelter also for animals. I have seen recently in Telangana also the similar situation. So a temporary shelter settlement for their animals, if possible, in your area of intervention, you can based on as a part of a project, you can add this also. So that will also be a good thing. And awareness goes a long way, and awareness to the community, like how Divya has mentioned, community-based awareness generation programs where they are involved in the process of training. Interactive learning sections can be done based on these materials, and based on the locally available information also, you can conduct such awareness generation sessions. With the so Kudumbashree, for example, in Kerala is a very good self-help group, and there are in every state like Asha workers, and every state there are self-help groups. And I would prefer women-led self-help groups because they are the ones who looks after these animals, and looks after the I mean more responsiveness to the kind of alerts and suggestions we give. These women-led SHGs really tend to like stand in front, and that's something I have observed over the course of my experience. And then promote natural or low cost materials, like I said, to construct these shelters. And these IEC materials can be shared through public transports like road transport corporations, bus and all, and radios and street plays, murals, etc. So these are some short-term solutions you can look at, and long-term uh, there are various veterinary emergency units and all set up in multiple states. Like such veterinary mobile camps can be set up for emergency response operations during the summer months. Some random. So we have such a system established in Dharwad district of Karnataka, which is working really good and helping a lot of people during this time. And training paravets and veterinarians to recognize heat stress signs early and and treat accordingly. Paravets often don't know, though so specific things like this. If trained well, they are a very good resource. And second, heat action plan at national and state levels for animals. I know that Karnataka, UP, and Himachal Pradesh also, Bihar is also have is having heat action plans, but a dedicated chapter for animals will go a long way. So all these, when I refer these materials, there are mention of animals, but we need a little more than that. We have clear understanding of how a training should be conducted. Oh, sorry, my voice is low, it seems. Can you hear me now clearly?
Yes, study.
So, we have detailed ones. If you are conducting a training, how the training should be conducted, what are the content should be added, the IEC materials, etc. We have seen during the presentations and all. But for animals, it often tend to limit in a sentence or two. So I'll detail the chapter on these heat wave action plans for animals also will be really beneficial. And then advocate for more animal safe transport laws. And animal inclusive DRR planning. So we call it like AI DRR. You can give it a fancy name or something like that. So animal inclusive DRR planning is very important. And then yeah, these are the kind of things I observe which can be done for heat wave related things. And we do a lot of things under our capacity in limited spaces of our country. And it needs a more larger approach, and one NGO cannot alone do these things. So if we together can actually work on this and add this part as a part of our interventions in these places will be really helpful. And I'm not mentioning wildlife and marine life here because but they are also very highly prone. The human wildlife interfaces we see now have direct connection to the increase of heat in the forest land. That again doesn't mean that you build a lot of small pond like areas in the forest. That's not a feasible solution. You need more researchers into that and understand what is needed, etc. So yeah, that's that. I think it's enough for now. We can talk more on a different occasion, but remember, please remember that it's our responsibility to be for our companion animals, and please try and do that.
Thank you so much, Praveen. Thank you for shedding light on such critical challenges faced by livestock as well as companion animals, and also offering some actionable solutions for animal protection and welfare. So thank you for that sharing, Praveen. So moving forward, we have our next speaker, Dr. Rohini Vadra, who's Assistant Director at Doctors for You, and comes with an expertise in healthcare system strengthening, donor relations, and strategic management. So Dr. Rohini, she'll be discussing about strengthening public health systems for heat wave response. So Dr. Rohini, over to you.
Hi, am I audible?
Yes, you are.
So thank you so much for this opportunity to talk about health and the impact of heat. Sitting in Delhi, it's front and center. I have a set of slides, and there you go. Excellent. So, a lot of it's a great topic, and it's very pertinent, obviously. There are a lot of overlaps. I love this, the agenda that you've put together, because there's people talking from various perspectives, and you can see that if we work in silos, we won't get either effective results or long-term impact. It calls definitely for intersectoral collaboration when we respond. So I have, my slides obviously talk in detail about that, but a lot of these points have been brought up. We can go on to the next slide. Before by multiple speakers, and so I'll try to keep focused on a couple of things. Who's most vulnerable? What are some of the things we should look at when we, before we respond, and what can we do as individuals? And we'll kind of gloss over the rest of the, you're welcome to the slides, obviously. So why is this, this was again brought up before, why is this pertinent? Because with climate change, we're seeing more and more heat islands. We're seeing more and more intense periods of high heat. These were not things that ever happened either so often or so severely or so for such long periods. And so, you have some examples here. 2023, our own country, and then 2022 in Europe, where there were all these people of all these France, the people in Europe kind of struggling with the heat, and all of us wondering how hot could it be, but it was. And so moving on. Now, who's most vulnerable when you look at, it's the elderly, it's children, it's people with chronic disabilities, and people who are outdoor workers. Elderly for a couple of reasons, right? They have, just like children, auto regulation of temperatures, kind of, the capacity kind of wanes. Children don't have that ability, especially very young children. You see the same thing in older adults. Older adults, you also see a lot of social isolation. With young children, they need to, and children, they need to play outdoors. How do you balance? And they're not that bodily aware. So how do you balance that need to play outdoors with staying hydrated, staying safe, recognition of symptoms? What should they look for? And then outdoor workers, because they're working, they don't have the flexibility to, say, acha garmi lag rahi hai, let me take a break. That results if they're, that results in direct either firing if they are construction workers, they're working for somebody, and if they're just, street vendors, then it's loss of income. And so this balance of, how can they stay protected and yet continue with, and then obviously anyone, irrespective of age or gender or this thing is people who have chronic diseases. A lot of the diseases as well as the medications that you take make you hypersensitive to heat. And so you see that a lot of people who have chronic disabilities, who are on medications for, let's say, rheumatoid arthritis or other autoimmune diseases, especially cancers, they're very sensitive to heat. They might hyperreact. And, it's a lot of times it's not just a physical, it's not just a psychological reaction, it's also a physical reaction. They might break out in hives. You'll see skin reactions, stuff like that. So moving on. So 4 pillars of how do we prepare. And the first is obviously, identify. How do you recognize the symptoms of either heat exhaustion, heat stroke, dehydration? Making sure we are aware. And so that pillar goes on to self-awareness as well as a campaign for awareness. And, I think Divya talked about this, using video games, using your cell phones, using SMSs, using AI, using tools that we use for other things for awareness as well. Training, making sure, and capacity building, making sure that health workers are trained, and then hospitals are prepared and all health facilities are prepared for surge capacity. Whenever you have, train accident hota hai, so suddenly hospital is overwhelmed because instead of, the regular 20, 30 people that they deal with, now they're dealing with 220, 30. And so, and that's what happens when you have emergencies, right? So heat waves, cold waves, suddenly, being able to deal with one, having the supplies, the consumables, the medicines, the the training, the consumables, as well as the capacity. So 3 things. Making sure that there are protocols and SOPs. How do you respond? So the minute, जैसे Saturday को I think Delhi के लिए heat wave warning थी. So there was a warning, but then what did that trigger as far as, at every level of government and healthcare or information? So if it is, an animal shelter, how do they prepare? If it's a government hospital, if it's a private facility, if it's, an RWA, if and obviously then the emergency personals, right? How does that warning, the early warning, result in preparation? That kind of standardized protocols. I think we have some of those in place. There are still some gaps. And then obviously dissemination, what I talked about, awareness. Next slide, please. So these are some of the health missions. Like I said, we've talked about a lot of these. So I'm just going to move on. But I wanted to, focus on the last 2 points. That heat wave risk maps is not just the purview of the weather department. This also, if you have major healthcare centers, it's very important that they have the manpower and the training and the infrastructure to do this. Because usually when adverse events happen, they become by default the action centers, for response. So making sure, and then obviously coordination with local emergency services. Next slide, please. So a lot of these are overlapping points, and we talked about we have to have public health measures, we have to strengthen health infrastructure, but what do we do in those cases? So same with resilience building, we talked about training, capacity building, policy and governance, creating SOPs, intra-sectoral coordination, but then also reducing disparities in heat vulnerability. How do we do that? There are obviously, it's a known fact that there are certain populations, socioeconomically vulnerable populations that are, just by, quirk of fate are more vulnerable to certain adverse events. And so how do you reduce that disparity and make it even, especially when it comes to, let's say, if we're talking about heat waves, so cooling, stations, hydration stations, obviously awareness, labor laws, making sure even if you're whether you're working in construction, then we do have as a nation, I think one of our biggest gaps is we have laws, but we don't have enforcement. And this is, across the board, it has nothing to do with emergencies. And then obviously funding, it's not just more funding, but it is also responsible funding, making sure that the funds are going where they're needed. Next slide, please. So some of the things, heat action plans and early warning system, we talked about this, and I think Ahmedabad is counted as a best practice case study for this reason, that they had an early warning system. They focused on community awareness, public education, and then also the capacity building that we talked about, medical staff training. So if we talk about the pillars, and then finally, next slide, please. When we're talking about detail, the awareness and first aid training that we talked about. So moving on. So these are the cornerstones: health system preparedness, community outreach and education, protecting our vulnerable, access to cooling and hydration, and obviously intersectoral coordination that I think Praveen talked about a lot. And so, I'll skip over the next few slides because, they talk in detail about these cornerstones. So Vishnu, if you can skip. And we move to call to action. One slide back, please. There you go. Excellent. So here, and this is, it's really everything that everybody has said, but basically we need urgent comprehensive action. We need to work together, not in silos. So collaborative actions, and then investing now, obviously to ensure a more resilient future. Finally, before I end, I want to talk about what we can do at a personal level to stay safe. So next slide, please. Thanks. What should you do? Stay hydrated. Stay indoors as much as possible, especially during the high heat times, right? Use fans, cool showers, damp cloths to reduce body temperature, when you come from outside. Wear cottons, lightweight, light-colored, loose-fitting clothes. And then curtains closed, windows obviously closed during the hottest part of the day. And I speak of this from personal experience. I had my windows open yesterday. I came back home after work and my house was an oven. And then obviously, next slide, please, protecting our vulnerable family members, checking on our elderly, whether it is neighbors, whether it's parents, aunts and uncles, also ensuring children are safe, making sure that parked vehicles, now it's, a lot of times we crack our windows when it's very hot, when we park them. I know that this may not be possible in all areas, but never leaving pets, children, or people in a closed vehicle. making sure that people are, jo hum karte hain already. Somebody mentioned aam panna, nimbu pani, making sure fruit juices, making sure that we stay hydrated. Children especially, they forget to drink water, but not just water, but also making sure salts are replenished at regular intervals. Having knowing the symptoms and knowing the early response activities. So just say thanda patti, making sure you have some medications on hand, ORS, and then obviously watching for signs and symptoms. Any questions? Thank you.
Thank you so much, Dr. Rohini. Really appreciate those valuable perspectives you have shared on strengthening healthcare systems and also highlighting the need for intersectoral coordination. So thank you for that. Moving forward, we have our next speaker. We are joined by Mr. Imran Majid, who is Program Director at ADRA India, and he leads the humanitarian and resilience programs with the 14 plus years of experience across 20 plus states in India. So Imran, I'd like to invite you to talk about scaling community-centric interventions for heatwave resilience.
Thanks a lot, Nupur, for giving me this opportunity. And I would like to congratulate Sphere India for organizing this critical workshop, because we're in the middle of heat wave and we're discussing the heat, how to protect ourselves and the communities, and also what could be done better. So I think these discussions are very important, and we are still, I would still call it timely, since this year, I think we started feeling heat since February itself. So maybe we could have started a little early, but I would still say it's timely because we're still in April and the real heat wave has just started. So congratulations on that, Sphere India and Nupur. So since all the panelists have spoken on all the technicalities from the beginning, I would speak more from the community perspective. However, Divya spoke on that as well. She already spoke on many aspects that I was going to talk on, but I think I will keep it a little broader, and in the interest of time, I will keep it shorter as well, as much as possible. So heat waves are currently the growing crisis that severely impact communities, especially those are already vulnerable to environmental stress. The extreme heat not only threatens lives but also challenges infrastructure, health systems, and local economies. So, Indian subcontinent is experiencing higher temperatures that arrive earlier. Like this year, it arrived from February. February was hotter than past many years of this year. So and stay for longer time. I think this year there is also prediction that heat wave is going to stay for a longer time. I was reading an article in the morning that the heat wave in 2025 is going to stay for the longer period than in the past. Extreme heat fueled by human caused climate change is adversely affecting the ecology, economy, and health of people. It does not only impact the people in the communities, but it also impacts the biodiversity. It is impacting us as a whole, as an environment, and as an whole community that is laying on the world, on the land, I would say. Extreme heat threatens the health and livelihood. So I'm talking about a little bit on the broader aspects of how and which of the components are getting impacted by the heat wave. Like when heat wave impacts us, when we feel heat, how it impacts the different aspects of life. So it affects the health and livelihoods of millions of occupationally exposed people in India. Like people like us may be doing work and traveling in the AC cars, doing work in the AC rooms, but there are a lot of people who work out directly in the under the sun. So according to the World Bank, India may account for 34 million of the projected 80 million global job losses from the extreme heat temperatures, which may amount for 4.5% of India's GDP. The most important and concerning factor is the urbanization in the heat wave. The communities that are living in the urban areas. Urbanization has led to the rapid expansion of cities, with more people moving to urban areas for better opportunities. As cities grow, they tend to replace natural land with concrete and asphalt. We have seen how cities are growing bigger and bigger, how the peri-urban areas are being developed. So, the concrete and the asphalt used absorbs and retains more heat, contributing to the urban heat, which we are facing in Delhi. All of us, those who are living in the cities right now, must be facing how, in the night, especially, how it gets more warmer. Because this concrete and the asphalt just throws the heat back in the night. Heat waves in India have significant impact on communities, especially in vulnerable areas. Prolonged high temperature can lead to high health issues such as dehydration, heat stroke, and respiratory problems, disproportionately affecting the elderly, children, women, low-income groups, um, and other persons with disabilities and other vulnerable groups. Additionally, heat waves strain water resources, reduce agricultural productivity, and cause power outages due to increased demand for cooling, further exacerbating economic challenges for communities. Heat waves in India pose severe risks to both health and livelihoods. The extreme temperatures can lead to increase in heat health illness, such as heat strokes and cardiovascular stress, which overwhelm healthcare systems as well, especially in the rural areas with limited access to medical services. Vulnerable groups such as elderly children and daily wage laborers face heightened risk in those areas. Agriculture is another aspect which is being severely impacted by the heat, such as the crops fail due to lack of water, extreme heat, leading to food insecurity and loss of income for farmers. Additionally, water scarcity worsens during heat waves as already limited resources dry up, affecting daily living and sanitation. Power outages become more frequent as electricity demand spikes, leaving communities without cooling and exacerbating the health crisis. So now, since this is the scenario and how the communities are being impacted, but what is the role of different organizations who are out there that are working with the communities on different disasters? And till now, I think all of us have prioritized different disasters. We have worked on different range of disasters, flood responses, humanitarian response to floods, cyclones, earthquakes. Um, COVID-19 was the new case for us, but I think heat is something which we have not thought much of, and we have not implemented any responses on this yet. Maybe some instances of isolated responses done by some organizations, like we did a one last year, but there has been no specific coordinated approach as of now. And I think still we as organizations are not very much thinking proactively and intentionally about heat waves. So I think there is a need for NGOs to think intentionally and also contribute to the larger framework and the heat action plans that are already being planned and developed by different disaster management authorities, including the NDMA, National Disaster Management Authority. In the beginning, some of the speakers spoke how the heat wave action plans have been planned, but there are gaps in the implementation. There is where exactly I would say NGOs have a bigger role. I think one of the major important roles that NGOs can play is the data collection and setting up early warning systems, wherein IAGs can be activated. Maybe we can work with IAGs. We can see how we can activate IAGs like we activate them in the flood responses. Like when tomorrow, if there is a flooding situation in any of the states, we activate IAGs. We do joint needs assessments. We do different activities. So I think we as a group of community of NGOs, we have the responsibility of um, activating our data collection mechanisms to feed into the system so that the proper response and planning can be developed. And also the early warning systems, like we are talking about anticipatory action now. And I think the heat wave is something where applying anticipatory action is very easy and is very relevant, because IMD gives us the warnings ahead of time. In Delhi, last week only we knew that this week is going to be the heat wave for Delhi, and it is there. So we have proper early warning by IMD for all the states. So with that information and use of technology, we can definitely activate our anticipatory action responses uh, ahead of time. And these are very low cost responses. Like heat wave may not be, we may think of the bigger responses also, but I think the best response that Divya already spoke and other speakers already spoke about, the communication sharing information. Risk communication is very important. So that is something which NGOs can also do. The which will cover the capacity building also of the frontline workers, the self-help groups that were already spoken of, the people who are already the workforce, the Abda Mitras, disaster management volunteers, those are already on the ground. How their capacities can be already utilized, how we can use social media, how we can use digital platforms for this. And also we can do some, the role of NGOs could be also to facilitate and advocate for some targeted relief programs. Like there is a larger population out there whose work gets impacted during this period, and so those people need support. So the support could directly come from the normal procedures that we use, maybe distribution of relief materials, but also we can refer them to the relevant programs, relevant schemes, the social protection schemes, wherein they can get some support. The public distribution systems can be activated, because I think, from my perspective, people get affected by heat mostly also because if they are hungry, if they have not eaten enough food, that also causes more heat stress on the people. So that food is very important for people. So we have to ensure if the food availability and access is in the community, and we have to build the partnerships with the CBOs, CSOs, government, and implement the programs collectively, because this heat wave is impacting us collectively, as a society, as a community, as a nation. So we need to collaborate with each other on all the impacts, like on all the activities, whatever those activities could be, maybe the greening initiatives, maybe the cooling initiatives, whatever that is. So we should be able to contribute in the ways that we want to. And there's a classical example right now being implemented in Delhi. NDMA has organized an knowledge partners group and also some technical partners group for implementation of Delhi heat action plan. So that group is right now working, is right now working on a document which wherein they are highlighting their capacities. NDMA is not giving uh, is not forcing anybody to do any activities. They are asking NGOs to come forward and tell what they could do in their own capacity. So NGOs are right now proposing that they can do these activities. So if all the organizations contribute in their own capacities, two activities, three activities, whatever is possible, I think this can become a bigger program and bigger response. And that is what is happening in Delhi. And they have already started working on this document and this program. I think they will start implementation also in this month. So the same process can be utilized and capitalized in other states as well. So there's a lot of work to be done and a lot of collaborations need to be done. I think I saw a good presence of the people who have worked in this sector in the past on this workshop. I think let us all collaborate, and Sufir India is in a better position to lead and facilitate these kind of collaborations and coalitions. Thank you very much, Nupur.
Thank you so much, Imran. You very rightly highlighted the need for a proactive and also a coordinated approach to address heat wave. And going forward, it will be interesting to see how NGOs can contribute to heat action plans and other national, state, as well as local frameworks. So thank you for that sharing, Imran. Now to conclude the session, we have Mr. Mihir Bhatt, who leads AITMI and has worked on extreme heat since IPCC's SARX report in 2014, and has also contributed to India's first heat action plan process in Ahmedabad, supported its spread in other cities of India, and has rated their performance from time to time. He's also been the part of the team to draw lessons for action from key global heat action project evaluations. And currently he's working on pooling measures with business community and is also engaged with several SDMAs on developing actions for making 2025 cooler. As he's a founding member and an active member of Sphere India, we are pleased to have him be part of this consultation to sum up the discussion and also help us in identifying collaborative priorities for future preparedness and also resilience building. So over to you, Mihir.
Thank you. It's always a pleasure to work with Sphere India and its young team. And what an excellent range of panel members, both in terms of their expertise and experience that they have. So we've got a very detailed list of actions that we could take from what has been presented here. And it's also very timely. I've been asked to sum up and talk about the way forward for strengthening heat wave preparedness in India. And I suppose it's for 2025. This is not something that we are talking about the future. So in terms of key takeaways for key takeaways, I've noted 6 main takeaways from this, combining the presentations that have been done by very, very exciting individuals bringing their experience. And in terms of way forward, I have one more, not 6, but 7 things that could be taken forward. So I will quickly go through this, and should you need any more details, because this is taken from the presentation, so I'm have not fully formulated, but I should have that done. So I'll be happy to either talk after this or subsequently be in touch with Sphere, and I'll be very happy to answer. So this national consultation has highlighted the escalating risk of extreme heat, but it has also highlighted the urgent need for comprehensive multi-sector response in 2025. So everybody was focusing on what we could do now this year very quickly, and that's something is a national mood, and this consultation has also underlined that. The deliberation by India's leading practitioners and experts, as we had, they brought forward the critical insights from across the country. There was a good geographic coverage from the experience that they and expertise that they brought. Also institutional challenges, working for various types of institutions, and what we gathered today is, has that institutional challenges. Of course, science of extreme heat and the solutions, Divyaji, for example, or for example, Imranji, very concrete solutions that could be done in terms of building resilience to extreme heat. So that was something, in short, a very good coverage, comprehensive, that we have. The key takeaways is the main 2-word takeaway for me is that everybody said that there is a need for paradigm shift in the way we deal with extreme heat. And that's something needs to be done. So we need to do 2025 extreme heat response different than 2024. So that's a major shift, and that's what Sphere India is instrumental in actually doing. The first paradigm shift that I see from 24 to 25 from today's presentations is that from learning from 2024 heat, which is what we were talking about before, now there is very much focus on action for 2025. In fact, anticipatory action, if I use the word of Imran. So that is very much. So from learning to anticipatory action for 2024, and that's a major shift. And that includes a whole range of things, such as how do we make heat action plans, for example, which is very much topical, not in terms of response and relief, but in terms of anticipatory action, anticipatory action plans, and how do we actually implement. So that's one. The second major shift I see from 24 to 25 is from integration to broad-basing planning. All the planning processes, organizational planning processes, we have good examples. We have regional planning processes, urban, rural, state, both. We also have planning processes described in terms of special needs, such as animals, for example. But all the presentations I found were talking about integration, not integration anymore, but or mainstreaming anymore, but broad basing. That is, having far more larger definition of whatever sector, whatever organization type, whatever measures that they were taking. So we can't be very narrowly focused on extremely technically, scientifically defined, but in a much larger way. That's something. The third major shift I see that from health system strengthening, that our hospitals and clinics and PHCs are better, we move to promoting well-being. So not only when you are out in the extreme heat on the street without something on your head cover, without water, what do you do? But even when you are indoor and in a shaded area at home, what are the measures that you need to do, take so and anticipate that when you do go out and when you do go out and work, you will be better protected. So that's the third, from health to well-being. The fourth shift I see from the presentation that we discussed today is from inclusion of animal welfare, for example, special group, to all nature approach. That it's not only the animals, it's also, of course, the birds and all the living creatures, and of course the water, and of course other vegetations and plant as well. So that's a major shift, that it's not only concern about human beings, but life at large and nature at large. And that's a very important and very clear shift that once saw in today's presentations. The fifth is, last year we all talked about institutional leadership, and that's state authorities, city authorities, NGOs, civil society organizations, and there should be somebody taking extreme heat-related actions and lead that. But here we see that today, that from institutional leadership to the importance of collaborations, that all these, the more we work together, and here Sphere, this whole example is very good, that Sphere India has brought all these various stakeholders together, both in terms of panel, but also the participants, all of you, but also more importantly, all the IAGs that work at the state level. And that is something, the major shift that I see. The sixth is from the talk about localization that last year we talked about it. Of course, it still remains very important. They continue to remain very important. But from that to community leadership, so community-led actions, that not only the actions are local by local authorities and by local organizations, local communities, but actually the leadership will come from community to take these actions. And that's the sixth. So these are the six sort of shifts that I see coming from 24, 25 from the presentations that I have. A few more could be added, but I'll stick to this for the moment. So if you have this shift, what is the way forward and what kind of concrete measures we actually take? And the first and most important is, maybe Sphere India with NDMA or whoever. And there was a mention about Imran, mentioned about that, but I don't know how active and how well rooted it is, but build a national heat resilience platform with NDMA, maybe by Sphere India, by all the IAGs. But national level is very important, but all the IAGs at a state level, with STMAs that happens, that would be very good. It will just short circuit a lot of actions that are being taken at the state level to learn from each other and actually start implementing better. So that's the first way forward. The second way forward is to look at adapt heat action plans. If we have many, we can make many more as well, and we should, but make the heat action plans for fuller performance. So performance of the plans should become far more important in 2025 and I think they're the guidance of National Disaster Management Authority and state authorities will be very, very important to do. So that's the way forward from planning to actual performance of the plans. That doesn't mean you don't plan for the remaining places, but of course. So that's the second. Third very important way forward seems from today's discussion is to strengthen policy and governance performance with NIDM. And NIDM has done a lot of work around governance issues, some directly with extreme heat, some not so directly. Surya Prakashji also mentioned a series of them, but how they can play a very active role, even more active role during 2025 for the policy issues and governance issues in terms of performance again. So planning performance, policy and governance performance. So that's that. The fourth is to promote capacity building for national protection measures, social protection, including parametric heat insurance, for example. And maybe here UNDP has a very good facility available and can play a very active role. They have a global facility available for that with the National Disaster Management Authority, but the implementation should be at a state level, subnational level for actually making sense for this particular year. And that's something that is not that difficult. Some of the states have taken initiative. For example, in Nagaland, that is done. Assam, I think, is about to do, or maybe they've already done. But that's the fourth. The fifth is to accelerate community and NGO engagement, and this could be done underneath the IO, maybe some other authority, but that is something to accelerate the whole membership of various IAGs and Sphere India has. How all of us can be more active with the support and facilitation by the authorities that they are taking action. So that the sixth is to enhance early warning and forecasting system by the use of that. So IMD has really made remarkable progress in early warning around extreme heat. They're also moving to forecasting system, but the utilization is not only in their hand, but is also in the hand of people who receive the information. And their civil society organizations, IAG members, Sphere India members have a great role to play for 2025. And the seventh is about money, about investing, and investing in resilient cooling infrastructure. And that is something which is very important. And those investments that we can easily get guidance from CDRI or any other similar organizations on that. So these are the 7 way forwards that I see from this particular discussion that we had, which was extremely useful. I'd like to sum up by conclude that there is a strong call to action that's coming out from each of the presentations here and the way this consultation is done. So I think focus on action is very important, but not only action, but to move from reactive measures or appropriate measures to very proactive, preventive, anticipatory, inclusive actions around heat waves. And that's something which is very important. We have. I'd also like to conclude that what is proposed for 2025, I have proposed here based on the discussions that we had, but it's also true for the years to come. So it's something more long lasting, something short term, but it's also long term. But we shouldn't wait. We shouldn't wait, never. Just start implementing them here. The commitment of the stakeholders today lays the foundation for a more resilient and cooler India and ready to face the heat, protect its people, citizens of India, and ensure that no life or livelihood is lost to preventable heat extremes. That's something is very important to come out from this today's consultation. Thank you, Nupur, for this opportunity. I thank the panelists for their excellent presentations, which made me my task a bit easier to group them around both way forward as well as the paradigm shift that I noted. And all the participants, thank you very much.
Thank you so much, sir. And thank you for connecting the dots from the discussion today and helping us connect the field realities with the policy actions. Thank you for that, sir. It seems in interest of time, we won't be able to take the questions live, but feel free to share your questions with our team. We'll help you connect with the panelists and if needed, address them in the upcoming sessions on the topic. Now, as we conclude today's consultation, one thing is becoming evidently clear that the risks posed by extreme heat, they are growing, but it seems so is our collective resolve to address them. And so from the outcomes of this discussion today, we will be developing a comprehensive documentation on key discussions, insights, and also the recommendations. This documentation, it will serve as a reference point and an advocacy tool for the network to inform future planning and also strengthen coordination within the network. So with that, I thank once again each and every one of you for your time, your insights, and also your commitment to build more resilient India. And with that, we formally conclude today's national consultation, and we hope to continue this journey together. So thank you so much, everyone, for joining us. Thank you.
Thank you so much.